Hello, my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, February 16th. It is time for another live IC support group meeting. My goal with these meetings is to make you so strong, so knowledgeable, so informed that no one can ever mess with you again. Hi, Cheryl. Nice to see you. Always takes me about 5 or 10 minutes to get all the equipment functioning normally. And in this case, yet again, Facebook is being weird because when I type in my introduction for Facebook, it reverses all the letters. It did that a couple months ago for about 3 weeks. So hopefully they will fix that. So, anyway, my goal with these meetings is to make you so strong, so knowledgeable, so informed that no one can ever mess with you again, right? Right, right. We are long past the days where IC is considered to be all in your head. We know that IC now is a pelvic pain syndrome. We know that structures beyond the bladder can contribute, if not cause, most of the symptoms that many patients are struggling with. And we now know that all of those old therapies that, people did for months and months and months and years and years and years, and they never got better. Now we know why, because for many of those patients, it was absolutely beyond the bladder. So this is one of my two regularly scheduled support group meetings a month. I always do them the first and the third Sunday of every month. And as you see me looking around, it just means I'm working on my computer right now. They always start between 12:30 and 1 on the first and third Sunday. Here we go. Whew, now we're better. Um, I will go as long as you want me to go. Sometimes I go 2 hours. Sometimes we go 6 hours. My record is 6 hours. Yeah. And it's Daytona 500. I would love to be watching that with my dad. But anyway, it is what it is. Hello, Barbara. It's nice to see you. Barbara, what did you say here? Hold on. The woman of the hour. Hello, Gina. Hi, Teresa. Hi, Donna. Hello, Tony. Hi, Emily. So let me introduce myself. For those of you who are new, you kind of need to know who this woman is, right? So I am the National IC Support Group Leader. I've been a support group leader for 27 years here in the United States. I am the founder of the IC Network, the largest online support group in the world. I bring to the table 3 college degrees: a degree in chemistry, a degree in drug development pharmacology, a master's degree in psychology. And my website was actually my doctoral dissertation proposal for a PhD in psychology, which unfortunately I could not do because of my IC. I could not drive to school I hurt for about 5 years for me to be able to drive comfortably, much less drive 2 or 3 hours. Thankfully, I am living proof that patients get better. I no longer have pain every day. It's been a long journey. It's a long journey for all of us. There are many layers, many layers to this syndrome that we have to kind of unravel one at a time to try to figure out what's driving your pain. When you're looking for information on interstitial cystitis, I really hope that you will come to our website, icnetwork.org, because it is rated #1 in the world by Harvard Medical School and the University of London. In one research study, I will tell you, I was thrilled to see that our website was rated as good as the National Cancer Institute. You know what? I'm so proud of that. I'm so proud of all the patients who step forward and have helped us along the way and who have helped moderate our support groups and develop content and write all sorts of stuff, write blogs for us and all that sort of good stuff. So the way I do these support group meetings is I usually do a 30-minute intro or anywhere, although last time I did a 2.5-hour intro with some sort of lecture of some type. And then we will take your questions. And then at the end of it, I normally do some sort of giveaway. Last week, we gave away 4 books and 2 Sister Pro Check. And so I do plan on doing a giveaway, but you got to stick around, pay attention, because our giveaways I will always do a hard question. I will do a question that is based to some degree on something that we have talked about today. So we're long past the days of guessing a color. Hey, man, you're smart. You're smart. I know you're smart. We're not going to, you know, one of the great gifts of being older, let me just say, is that when you're young and you're in school, it sucks because you're being forced to learn stuff that you don't really care about. I mean, I remember I took 2 years of calculus. I didn't want to take calculus. I have not used calculus in a day in my life. I resented every minute of taking calculus. One of the gifts of being older, though, is that when you come back to school or when you are trying to learn something new, you're doing it because you're motivated to doing it. You're doing it because you want to do it. You're doing it because you want to learn more. You're doing it because you want to help somebody. And so I'm always surprised when people go back to grad school or they go back to college. And I mean, I still take college classes every now and then. I love taking classes. I love learning new things. So my goal here is to teach you a lot of new things. Now, I am on deadline right now with our winter magazine. For many of you know, the what we have been talking about for the last month is this new book, Breaking Through Chronic Pelvic Pain, a holistic approach for relief. I will have this for sale in our store shortly. There was a little delay in shipping it. I hope to have it up in our store on Thursday or Friday, but they had a problem with shipping, so it should come this week. You can get it right now on Amazon. I am not being paid to do this in any way, shape, or form. I'm doing this as a support group leader. My job is to share the best resources that I can with you. And I'm telling you right now, this is an absolutely fantastic book. And some of you, I mean, I've already given out, how many have I given out so far? Like 12? So some of you already have it. And I know one person said it's a little bit of a hard read. So honestly, the way that I study and the way that I try to learn stuff is I scan first. I just like go through and go, okay, interesting. Look at that. There's a chapter on that. There's a chapter on that. I'll do a very brief scan of a chapter and then I walk away for a couple of days. And then when it's time for me to really learn it, I come back and I read it again and then I take a lot of notes. And so these are my notes from the book, right? Like I have got page after page after page of notes. And I was actually reading through this yesterday because it took a week. Dr. Weiss has agreed to an interview, and last night I finished up my interview questions for him, and we will have that in our magazine. So, God, I gotta tell you, it's like every freaking chapter is so good. I don't even know where to start half of the time, right? So I want to introduce two concepts to you today. And he talks about these in the book. Okay. Hello, Nana. Nana says, I'm happy to be here. I have a question about the book and the subtype when you're ready. Okay, Nana, just hold on to that question real quick. Hello, Andrea. Thank you too. So, one of the problems with Western medicine is we compartmentalize everything. Like if you have a muscle problem, you go to a physical therapist. If you have a bladder problem, you go to a urologist. If you've got a reproductive problem for women, you go to a gynecologist. If you have a gut problem, you go to a gastroenterologist, right? And the flaw with that thinking, especially when it comes to the pelvis, is that it ignores the interrelationships. It ignores interrelationships. And thank you, Danielle. Um, it is an undeniable fact, as an example, that when you're in pain, your muscles get tight. And think about the fight or flight response for a moment. Go back 1,000 years, 2,000, 5,000 years in time. If you were walking through a hillside and you saw a saber-toothed tiger in the distance looking at you, what would happen? You go, right? And then internally, there's a chemical reaction that happens. It's called the fight or flight response. And in the fight or flight response, your body has a sense of self-preservation and alarm. Your body goes, uh-oh, Danger, danger, danger. I either need to run for my life or I need to prepare to fight. And when you're startled, you get a shot of adrenaline, and adrenaline shoots through your bloodstream, right? And it causes a pretty significant ripple effect, right? It prepares you. You get stoked. It's like caffeine on steroids in a way. What you don't know is on the inside, your blood is being redirected. Your blood is being moved from your core to your muscles, right? Because they want you to be able to fight and they want you to be able to run. So, that is a really good example of how our human systems are closely, closely interrelated. You know, that a scary thought or a scary movie can trigger a fight or flight response, right? It can trigger your body to get ready to run and to fight. Let's look at anxiety for a moment. When you're anxious, that creates another type of ripple effect. That's somewhat related. I mean, you would be anxious facing a saber-tooth tiger, but let's say, for example, you were a wolf, and we know wolves have dominance, and there's an alpha that's the boss of everybody, and then there's a beta, the second in command. It goes all the way down. And if you were at the bottom of the rung, and the alpha looked at you and came over and slapped you silly, didn't like what you were doing, how does your body react to that? How does your body react to that? Well, think about what a dog does. A dog drops his tail between his legs and they crouch. So, in a normal dog and a normal person, we have a nice arch here, right? There's an arch, and you're wagging your tail and you're happy. If you are under stress, what happens? Boom, you tuck under. It is subconscious. It is subconscious. So think about that dog when it is under stress and you've yelled at that dog or that alpha has yelled at you. You drop your tail between your legs, you tuck under, and your muscles are not in a normal, proper position. When you are anxious, if you are struggling with free form and anxiety, massive, massive anxiety, massive, massive, massive stress, you have to understand that there is a consequence to that. And the consequence to that is that you are going to subconsciously start tightening muscles. And that is why when you go to any good pain clinic, and really any good interstitial cystitis clinic, they're always going to ask, hey man, what's your anxiety level like? Are you struggling? You have a lot of pain? You have a lot of stress? And they want to make sure that that gets addressed. Because man, let me tell you, if they handle your bladder, they treat your bladder, they treat your lesion or whatever. And let's say they even treat your pelvic floor. They deal with some trigger points in your pelvic floor. But if you walk out of that office and you are struggling with massive, massive anxiety, what do you think is going to happen? You're going to tuck your pelvic floor muscles under again. You're creating a pattern of muscle tension that eventually is going to start triggering pain again. Okay. So again, this is an example of how the human body is so incredibly interrelated. In the book, he introduces two things I want you to think about. One is called a viscerosomatic reflex. So what that means is that your viscera, your stomach, your bowel, your bladder, can directly trigger something going on with your muscles. Somatic. So as an example, if you're having wicked IBS and bowel spasms or bladder pain, that pain is going to cause these muscles to get tight. we call that a guarding reflex. And I talk about it kind of like the chicken versus the egg dilemma, which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor? If the bladder is injured with with a chemical like chemotherapy, the bladder starts screaming. And those pain messages go up to the spinal cord. And then the spinal cord itself then triggers the muscles in the area to get tight to protect you. We call that the guarding reflex. So for those patients, our therapeutic priority is to calm and soothe the bladder. If we can calm and soothe the bladder, we know that the muscles should eventually release. That is what we call a visceral somatic reflex. Remember that. I'm telling you right now, write that down. That could very well be a freebie question. So we know the organs can trigger muscles. But there's also a somatovisceral reflex that muscles can influence organs. So we know when the bladder is screaming, the muscles will get tight. But how could a muscle affect the bladder? It's like, what? And again, when we think about Western medicine and we think about a urologist working with the bladder, they're only working with the bladder. They're only working with if the bladder is triggered first. But more of us have a muscle thing going on first. So how does that happen? How can tight dysfunctional muscles cause a breakdown of the bladder wall? Fascinating, right? I'll tell you how it happens. So what happens, and let's see, I can give you nice types of pictures here. Let's see, hold on a sec. I need to go to his trigger point chapter here for a moment. When you sustain a muscle injury, let's say you fall on your tailbone, okay? What happens to that muscle? Man, you fall hard. I mean, like, damn, that hurt. Well, generally, when you fall and injure a muscle, that muscle is weakened. And in the area of the injury, that muscle will then develop trigger points. Now, what is a trigger point? A trigger point is a muscle knot, right? It's a muscle knot. Here, hold on. Some of these pictures are really, really in depth. So what we end up with are like, you ever have a knot in your back? Have you ever had a knot in your back? And what do you do when you have a knot on your back? You ask somebody to push on it because, if you push on it, it will improve, correct? It gets better. So what does a trigger, dang it, where is this picture? I'm looking for this picture. Hold on. Come here. Let's see. I think I photocopied it and put it in my notes. Hold on a sec. So the question is a trigger point damaging? Is a muscle knot damaging? And the answer is yes, it is. Because you have long, skinny muscle fibers. And in and amongst those muscle fibers are blood vessels and nerves. So what happens is when you get a muscle knot, it basically breaks the blood vessels right next to it. And when you break the blood vessel, supporting that muscle, it cannot be healthy. So that muscle gets weak. That muscle cannot do what it's meant to do. The second thing that muscle knot does is it influences, damages, or presses on nerves. You get nerve compression. And nerve compression is a bad thing because nerve compression hurts. Okay? It is painful. So what happens then is here you've got this injured muscle and you've got trigger points, and the trigger points are damaging the muscle fibers. And basically the muscle fibers start screaming, help, 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 help. Ow, 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 ow. What the hell's going on? This hurts. Like me yesterday with my muscles because I did a little too much of what I was working on. And all of those pain messages go up to the spine. That's their job. You know, pain messages go to the spine and they go up to the brain for action. So here you've got ow, 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 just constantly hitting the spinal cord. Ow, 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 ow. Now, the thing about the spinal cord you got to understand is that the pelvis is a very small, confined area. So the nerves for the bladder and the nerves for the muscles and the nerves for the vulva, they're all in the same place. They're all in the same place. So what happens is we get something called neuro crosstalk. And that is, or kind of like overflow, for lack of a better term. Here you've got all these muscle nerves firing up to the lower spine. Ow, 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 ow. And those chemicals have to go somewhere. They don't all go up to the brain. They don't. They stay in the area. And what happens is they hit the nerves for the bladder and they hit the nerves for the vulva potentially for some of you, or they might hit the nerves supporting the rectum. And so now the bladder nerves have become sensitized. And then what happens is that neurosensitization goes right back down those nerves from the spinal cord into the bladder wall. Now, the flaw with neurosensitization and neuroirritation is that nerves that are irritated release damaging substances. And you've probably heard me talk about this before. It's called substance P. And substance P is tissue damaging. So here you got a nerve screaming, ow, 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 ow. In the localized tissue, that localized tissue turns red, and it turns red because the nerves are releasing substance P. And then, because you've got so much substance P in that tissue, which is now damaging that tissue, the mast cells get turned on and you get histamine release. You get what we call degranulation. So you've got substance P damaging tissue, triggering mast cells. And you know what happens? Histamine then irritates the nerves even more. And then you've got more substance P, and you're stuck in this horrible vicious loop, this horrible, terrible vicious loop of inflammation. Now, if you look at the IC therapies that the American Urology Association talks about, they talk about using an antihistamine. Why? Because that turns off half of that inflammatory pathway. They also talk about using Elavil, a low-dose antidepressant. Why? Because that calms nerves down. When they suggest you use an antidepressant, they're not telling you it's all in your head. They're not telling you that you're depressed. What they're trying to do is calm the nervous system. And so they want you potentially to be on an antihistamine. They want you to potentially be on an antidepressant. But the flaw with that approach is it's not addressing the fundamental problem. And the fundamental problem is, in fact, tight, dysfunctional muscles overwhelming the spinal cord with pain messages that's irritating all of those nerves. So that is the equivalent of a somato-visceral reflex. So what I want you to, I mean, you know, like I don't have this big long lecture prepared for you today like I did a week ago. I kind of exhausted myself a week ago. Um, what I really, really, really want you to understand is the totality of the pelvis and the totality of the human body. Nothing stands alone. The bladder does not stand alone. It has many, many influences, and it has the ability to influence many other things. And as Dr. Weiss talks about in this book, it's a kind of a layer by layer by layer process, right? And so when a patient would go into his pelvic pain clinic, really, obviously, one of the very first things that he would do is a very thorough examination of the structures of the pelvis, right? So he's going to be, in particular, muscles. and he did, because he's retired now, unfortunately, he did an incredibly thorough examination of all the different muscle groups inside the pelvis, and then the muscle groups that lead to the pelvis. Because if you've got tension in your hamstrings, if you've got tension in your thighs, if you've got tension in your lower back, those are all going to trigger tension in your pelvic floor. The pelvis doesn't stand alone. And so, what he would do then is he would work on the muscles and the trigger points. Okay. Because obviously that's a big part of the problem. Then, of course, if that patient is having bladder symptoms, we want to do therapies that would help to calm and soothe the bladder. One of the things that makes him really, really, really unique is that he also focuses on nerves. So, in fact, one of my questions that I sent to him last night is, you know, slowly but surely, urologists are recognizing the role of the muscles in IC, but very, very few of them are willing to recognize at this point in time the role of the nerves in IC. And, IC subtype 4, pudendal neuralgia, we've always considered to be a fairly small subtype. Think of the five subtypes. We've got Hunner's lesions, bladder wall driven, pelvic floor driven, pudendal neuralgia, and central sensitization. And whenever I've looked at those subtypes, I've always thought Hunner's lesion's the smallest, pudendal neuralgia second smallest. And his line of thinking is very, very different. He really believes that muscles irritating nerves are a huge under-recognized contributor to bladder symptoms and pelvic pain. And so in his examination, he also looked for nervous system dysfunction. So how did he do that? Now that's really interesting. So like we know, for example, one of the signs of pudendal neuralgia is if you have pain when you sit down that is relieved by standing, right? So I've always said pudendal neuralgia is really manifested in positional symptoms, that you're fine when you stand, but when you sit down or squat down, it hurts, right? But he looks for much more subtle signs of central sensitization, such as, is the skin in the area sensitive? Is there a numbness? Is it sensitive to the touch, right? And um, he also looked at something called subcutaneous tissue, where so subcutaneous tissue is the tissue between your skin, uh, below your skin, but above your muscles, right? And so, like if you squeeze here, right, the subcutaneous tissue is underneath this layer of skin but above the muscles. And the subcutaneous tissue is where you've got your fat. It's where fat lives, it's where blood vessels live. It's subcutaneous tissue is what controls your body temperature, which is why people who get really, really thin are often very cold. All right. And so he looks for signs of nervous system dysfunction in subcutaneous tissue. Is it firm? The human body is meant to be very loosey goosey. Muscles are long and lean and pliant. Your skin is supposed to be healthy and pliant. Your subcutaneous tissue should be very squiggly, right? Squiggly, right? And yet, for those of you who've ever had surgery, that the skin around the scar and underneath the scar sometimes gets very stiff. And that to him is a sign that we have to also address any nervous dysfunction there. How did he do that? He uses a lot of topical lidocaine on the skin. When I say, I don't mean a lot as in the quantity a lot. It just means that it's a common therapeutic method. And he even developed something fairly new, which was a subcutaneous infusion of lidocaine that really helped quite a few patients. Mary says here on Facebook, I bought the book, changed my life. Right? I mean, guys, like, seriously, are we talking? Finally, the dots are connecting. It's making so much sense. So, again, so Dr. Weiss looks at the muscles, looks at the organ. He's a urologist. Obviously, he's going to look for Hunner's lesions or stuff like that. He's also going to he would spend a lot of time examining the nervous system, and he's going to look for anxiety, because again, if you're super anxious or stressed, you are tucking your tail between your legs, which means you are tucking your pelvic floor under and creating an imbalance in your muscles and tension in your muscles. He's going to look for bony abnormalities. Do you have scoliosis? Do you have one leg longer than the other? Is there anything weird going on with the hip? Right? And he even looks at nutrition. And this, man, when we think about nutrition in the IC community, we're really thinking about avoiding those foods, high acid foods, which we know have the potential of irritating a sensitive bladder. But he looks at nutrition from the perspective of muscle healing and health. As an example, in his book, he says he wants everybody taking a multivitamin. Now, of course, we don't do IC patients don't do well with a typical multiple vitamin. We have to do a low acid multivitamin. But what he's talking about is creating an environment that will support healing. Healing. And you know what? I was looking for that reference in the book, and it was a question that I gave him. Um, we have a lot of debates and discussions about, is going vegan the right thing to do? And is going all vegetarian healthy? And my answer back to that has always been, number one, we're not, yeah, I mean, we're not carnivores and we're not herbivores, we're omnivores. We as a species are omnivores. We are meant to eat meat and we are meant to eat plants. And that means that meat proteins, like as an example, iron, the iron that you get from eating meat is essential to how, our blood, the health of our blood and our ability of our blood to carry oxygen. And it's very common that somebody who's vegan has gone vegetarian, they will often be struggling with anemia because they're just not getting enough of that heme and all that sort of stuff. So anyway, he also brings up the concept of nutrition and are patients struggling with any nutritional deficiencies, which could be impacting the ability of their bladder and their body to heal. And, it's just, here's what he says he also, I will say, after the bladder chapter, he has a vulvodynia chapter. He's got a chapter on rectal pain and genital pain. He's got a chapter on persistent genital arousal disorder, also known as PGAD. And then he also has a chapter on a very strong bowel spasm that I kind of want to talk about. But in his vulvodynia chapter, how do we treat vulvodynia holistically? Number one, we want to work with the muscles. Failure to treat and rehabilitate dysfunctional muscles is a missing link for all subsets of vulvodynia. Muscles can be a primary, secondary source of pain. An injury to the tailbone in childhood leaves latent trigger points, and that increased tension is essentially dormant for years until another event triggers the pain. Now, remember, this also applies to the bladder. You could swap bladder for vulva. Number two, pudendal neuralgia. He believes that unprovoked vulvodynia is secondary to pudendal neuralgia. If the nerve is extremely tender and a history of potential injury, a nerve block should be performed. Number three, he looks for subcutaneous tissue sensitivity and restriction. And if he finds it, he's going to do skin rolling and things like that. Number four, vulvar sensitivity, skin sensitivity. The vulva has many nerve fibers, the most sensitive in the female body. Whenever nerves are irritated, nerve endings release pain producing inflammatory agents that can trigger flares and over time central sensitization. We must protect the skin with a barrier treatment like coconut oil. All right, number 5, stress. Emotional stress will activate and maintain vulvar pain or pain anywhere in the body, including the bladder. It causes muscles to spasm, it increases adrenaline output, it fires up nerves, it blocks natural painkillers, endorphins from working, it triggers central sensitization, then it spreads, escalates, and perpetuates chronic pain. Stress is like pouring acid onto a sensitive skin. The speed of the treatment, let's see, the speed of the reaction is amazing. Muscle spasm, adrenaline increases when, okay, well, anyway, okay. Number 6, we're going to work with central sensitization. When the central nervous system is overwhelmed by incoming pain stimuli and becomes hypersensitized, um, what is that? Oh, this changes the spinal cord receptors physically, chemically, and genetically, also known as neuroplasticity. Okay. So, my theme here, whether it's the bladder or vulvodynia or rectal pain or scrotal pain or anything at all like that, is you understanding that yes, that organ can be injured. So, how is the bladder typically injured? Well, unless you've got a bullet wound or a stab wound, the number one way that a bladder is injured is going to be through potentially some sort of chemical exposure or through infection, right? But what he is arguing, I think, remarkably successfully to all of us, and what he says in his book is that for almost all of his IC patients, he could go back in their history and find a traumatic event, a physically traumatic event or trauma to the pelvis. Whether it is a fall, having a baby, a surgery, a rape, a history of abuse, that at some point in time there was a trauma to the pelvis that created the foundation of muscle dysfunction, trigger points. They might have been silent trigger points at first, but then what they see is a history of recurring trauma. So if you are a guy with IC, we would look at, as a kid, you falling on your tailbone. Then once you're on your bicycle, you riding a bicycle and maybe jamming your tender bits on the bicycle bar, which would potentially irritate muscles and directly irritate nerves. And then maybe by the time you're in junior high or in high school, you're playing football. And bam, you're taking major pelvic trauma. And that would then start creating the foundation for weakened muscles, latent trigger points. And then at some point in time, a trauma happens and bam, you have pain. And then bam, you start feeling bladder symptoms. And for some of you, your first symptom might be a bladder symptom. It might not even be pain. You have no freaking clue you have an injury to your muscles. But what you have is you got to pee all the time. You got frequency urgency. And normally you go to the doctor goes, hey, must be infection. Let's throw antibiotics at you. You take antibiotics. They don't work. You go back to the doctor goes, maybe you got prostatitis. Throw prostate medications at you. They don't work. Go back to the doctor. Doctor says, oh, maybe you got overactive bladder. They throw detrol at you, ditropantodetrol. They don't work. Go back to the doctor. Doctor goes, well, you must have IC. Let's give you Elmeron. Let's show you in the door. It's all in your head. When the foundation actually goes right back to muscle stuff, right? And remember, we knew this 100 years ago. 100 years ago, if you look at the journals, medical journal articles, actually from the 1800s, that talked about IC, but especially in the early to mid 1900s, they describe muscles so tight they resemble tight piano strings. So we've always known that muscles were an issue. One of the other things that he talks about this is he goes back in history, and I think it was in 1981. 1981. that we had doctors who were saying in journal articles, look to the muscles, look to the pudendal nerve. But again, the flaw of Western medicine is that it doesn't train doctors to look beyond their trained organ. Doctors, even today, doctors don't really, they're not trained about the influence of the pudendal nerve on bladder function. So you are an anatomical mystery to be solved, and there are going to be layers of dysfunction that we've got to figure out. That you've got to figure out. And yes, if you got bladder symptoms, you got to protect your bladder. You got to follow the IC diet. But don't assume that it's some sort of core fundamental bladder dysfunction that's causing all of this, when it actually could be a core fundamental dysfunction of your muscles that are creating the foundation for all of the nerves in your pelvis to be irritated, triggering rectal pain, triggering vulvar pain, triggering bladder pain, and all of the symptoms. And the other thing he talks about, he gives the name. Okay, all right. So here's a question for you. Which muscle Which muscle can cause frequency urgency? Any idea? Any idea? The muscle's right down by your urethra. If I was doing, so, you guys know, Vicky says, I always miss the name of the group, the name of it. Somebody will tell you, Vicky. So this has been really mind blowing for me personally as a patient because as I was reading this book, I was going, oh my God, wait. I first had frequency urgency in junior high. Couldn't sit through class. Was diagnosed with urethral syndrome, endured about 100 urethral dilations. Well, what did we find? Scoliosis. And so I think back to that young girl who endured many painful procedures, and the humiliation of not being able to get into class, and teachers laughing at me and going, really? And you must hold it, even though it was very uncomfortable. Thinking it all could just go back to the freaking scoliosis tweaking my muscles. And I do think that's actually the foundation and origin of my fundamental issue. Yes, I'm a redhead. Yes, I have sensitive skin. So, anyway, I hope that this book is giving you a lot more things to explore. You are a mystery to be solved. For many patients, it goes down to their feet. If you got one leg longer than the other, you are not walking normally. Your weight is not being distributed correctly to your pelvic floor muscles. That is creating imbalance in your pelvic floor. That is creating tension on one or both sides of your pelvic floor, which could absolutely be irritating your bladder. It could be the foundation that's leading to all of your bladder symptoms. So anyway, you know, I'm just stunned. I'm just stunned and kind of sad. I'm sad for the girl that I was and for the years that were wasted. And for many of you, I know you feel exactly the same way. And I think the good news now is that we don't have to be sad anymore about it. Hey man, the past is over. It's done. Gotta let it go. It is what it is. I'm here today. That's all that matters. Is that now we've got the information that we need to go back to the doctor and say, all right, I'm ready to look beyond the bladder. All of your bladder therapies that you've given me are not working. I am not where I want to be. I am not where I need to be. I want to be able to live my life again. I want to be able to work comfortably. I want to be able to enjoy events with family members and friends. And your bladder therapies have only gotten me to this point. I want to get here. So I am ready to look beyond the bladder. I would like a pelvic floor assessment at a minimum. And most of the top clinics in the world are doing pelvic floor assessments at your very first appointment. But even if you get that, and they say, yeah, man, your muscles are wicked tight, and they send you to a pelvic floor physical therapist, the pelvic floor physical therapist has a very, very complex job to do, because not only do they have to teach you how to work with your muscles, and they've got to assess your muscles correctly and address any trigger points, but it doesn't happen overnight. And the thing is it's uncomfortable at first. It can be uncomfortable. Nobody wants to have somebody's finger up their vagina or up their rectum working on muscles, but that is in fact exactly what they have to do. And I have now made a commitment to myself that I am going to do my internal wand every 2 days. Every 2 days. And it's so interesting is when I went through when I went through pelvic floor physical therapy and the examination, what they'll do is they'll put their finger in your vagina and then they'll say, okay, squeeze and release. And it was always super easy for me to tighten my muscles, but it was hard to relax them. I could tighten a muscle in a second, but the relaxation phase would take a couple of seconds. And now, if I do my internal work and I get those muscles to release internally, um, I can actually I can tighten and release immediately, which is very, very different. Sorry, guys, it's hot here. I gotta put my hair in a ponytail. And so, I'm the first to be somewhat passive aggressive when it comes to physical therapy and not doing what we need to do, but I am extremely invested in wanting to get my muscles normal and healthy again. And it takes a lot of work to do it, and it's uncomfortable at times, but it is what it is. You got to do it. All right. So anyway, sorry to ramble a little bit. If you go back and you look at last week's support group meeting, this really deep, thick lecture that I did for 2.5 hours that I think you would find very, very helpful. Let's just go ahead and dive into your questions. Time for a quick drink. All right, so if I'm looking up, I'm looking at Facebook. If I'm looking down, I'm looking at YouTube. So let's start with YouTube here for a second. Hello, Andrea. Andrea says, I hope you are all feeling empowered. We are a strong group of people. We can do this. You better believe we can do this. We're going to kick some butt. Man, I'm sorry. We're not going to be passive anymore. We're not going to accept a doctor saying it's all in our head. I want you to walk into every doctor's office so strong, so knowledgeable, so informed, ready to engage in a good discussion with them, eye to eye, eye to eye. No looking down, no shame, no blame. You pay them, they don't pay you. You're going in there for their consultation, but they're not the boss of you. You're going for their knowledge, information, and the opportunity to evaluate your body. And if they do not do it well, if they disrespect you, the goal then is to move on, right? Strong, empowered, forceful, but always kind and respectful. You do not, you don't bite the hand of the mouth that feeds you or potentially gives you medication. You always have to be respectful. Patty says, hey, hi everyone, and thank you so much for the pelvic pain book. Got it in the mail a couple of days ago. Patty, hope you've read at least one chapter. Hi, Curtis. Andrea says, gosh, this sounds like me. Anxiety has been with me from childhood. Yeah, me too. Kay says, hi, Jill. Got my Sister Protect. Thank you so much for it. Yeah, so we gave some Sister Protect away. I still have more to give away. You can see it up in the shelf right there. Grace says a C-section would be traumatic, right? Oh, hell yeah. C-section, absolutely traumatic. Nana saying detrusor. The detrusor muscle is in the bladder wall. It's a smooth muscle as compared to a striated muscle of the pelvic floor. Kay says, Jill, do I use anything on the wand or nothing? And I mean, like, guys, I'll talk about anything. I'm really like brutally honest, and I don't care if I humiliate myself. Listen, man, we're all adults. We have to have a place to talk about it. So this is the wand Easy Magic by IC Relief that I personally use, and this is what it looks like. Because remember, you've got 3 layers of muscles. You've got shallow muscles, you've got mid-level muscles, and then you've got very deep muscles up by your bladder itself. And there are times when you need something that's a little bit longer to reach any trigger points or something like that. And God, it's so hard to like before before my hysterectomy, I had no problems doing it, but I never did it anyway. I don't know. I just in my brain, I was just thinking bladder, 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 even though I've always known I've had tight muscles. I mean, like seriously, I'm the leader of the IC network. I was there when the pelvic floor stuff was discussed for the first time. I had my muscles checked. I knew they were tight and I did nothing. I did nothing. Right? Like, oh my God, Jill, Ugh. Um, I find it very surreal and kind of sensory to try to do the internal work. Um, because you have to kind of so like now with the book, I really have a much better understanding of where the muscles are located. And so as I'm using my wand, I'm visualizing which muscle I'm working on. So, like, I know that if I'm along the sides, I'm working my piriformis and my obturator muscles on both sides. I know that if I'm working below, I'm working on my levator ani muscles. And you know you're working on your levator ani if when you work on the muscle, you feel a pressure like you have to have a bowel movement, you're not going to have a bowel movement. It just means you're working on the right muscle. And so I find that this is the first tool that and resource that is really helping me do it the right way. Otherwise, I would just kind of stick it in and just kind of push around. And I didn't, there was no rhyme or reason. You know, it's like, okay, I'll push over here and then I'll push over here and yada, 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 yada. And what my pelvic floor physical therapist kept saying is, Jill, you have to use a J shape. You need to go like this and think about it. So here's your pelvic floor. I mean, your general shape of your pelvic floor is somewhat like that, and then you've got levators up here. And what she was saying is, take your wand and go up, do a J, like do it. And now that I'm able to do that, I'm I feel it much better. And so when I go back to if I try to do a Kegel, I can do a Kegel and I can release immediately. There's no delay in relaxing the muscle. I know I've restored that muscle health. But I also know that I can't just do it once a week or once a month. And I'm extremely passive aggressive at times when it comes to pelvic floor work and to my own, you know, to my own damage. And so I'm trying to be really, really consistent now. And I'm feeling the difference. So anyway, Nana says, yeah, Nana, you need to redo your question. You just said detrusor question mark, but you don't say what your question is about the detrusor muscle. Len says, I was finally able to go to a podiatrist after the first book discussion back in January and found out both of my ankles are pronating. So that was pretty validating. Yeah, baby. I still haven't gotten back to the podiatrist myself. I will say that I am using, what? Wait, hold on a sec. Oh, that was funny. Okay, hold on. Did you see that? My foot just hit my chair. All right, hold on. Ah. Hey man, it's not a support group meeting with Jill Osborne if something doesn't happen. All right. So Len, I was going to tell you that I have Morton's toe on both sides. It's not wicked Morton's toe, but it is a little bit of Morton's toe on both sides. And I have been using the toe pads in my main shoes, and I absolutely notice a difference. And like when I took a shower today, I could immediately see that I was balancing on the outside of my feet rather than on the big toe and the little toe. And so the toe pad for Morton's toe is really helping my legs a bit. Ironically, though, I got a new pair of shoes and I did it in my new pair of shoes that were not broken in, and it's uncomfortable. With this pair of shoes, which is about 6 weeks old, it's comfortable. So anyway, Kay says, in the new book, does he show you the muscles to work with on the wand? Man, let me tell you, let's just say your knowledge of the muscles is going to, and the ligaments and the nerves and the bones, it is going to be changed forever. And you know, guys, one of the ways that I learn is through color, and so I always have to color things so that they really resonate. And so so I always photocopy the picture and then I color it. I've been doing this since high school. Um, so your pelvic floor muscles are the muscles that go from front to back. Like, so here's your tailbone, here's your urethra. The pink is your piriformis muscle that goes up the side. The darker green is the obturator muscle. So the piriformis muscle is more kind of on the back side of your body. The obturator is more on the front side of your pelvis. And obviously, the pelvic floor is composed of a couple of different muscle groups that all interact. So you've got the levator ani, you've got the pubococcygeus, you've got the iliococcygeus, and stuff like that. But anyway, um, the other thing in this book that I think is really, really useful is, look, he talks about how nerves go through muscles. So, as an example, this is the foundation for the pudendal nerve coming off the sacrum. And you will see it is going through and under the piriformis muscle and the obturator muscle. And so, if your piriformis muscle is tight, it is going to be squeezing the pudendal nerve and creating problems with the pudendal nerve. So, he's very, very good about anatomy. Um, Here's another thing I think that's really, really interesting. So, for a lot of us out there, whether you have vulvodynia or IC or whatever, um, there's one hot spot, especially for vulvodynia, and that hot spot is the perineum. The perineum is that little bundle of tissue between the rectum and the vagina, or for a guy, between the rectum and your penis, right? It's that little bundle of tissue that is often super, super wicked, wicked sensitive, right? And it is called the perineal body. And here it is. And look at all the muscle, 4 different muscles attach right here. And so that's why the perineum becomes wickedly sensitive, is because it is basically a center attachment point for several groups of muscles. All right, let's go up to Facebook here. Now, you guys, I apologize with Facebook. I got to open up my picture, which is why I'm looking down now. And even then, it doesn't let me scroll back. Sometimes it does, sometimes it doesn't. If I missed your question on Facebook, please, 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 please ask it again. Don't take it personally if I missed it, just ask it again. Not quite sure what Erica and Laylee's is talking about. Molly, how do you cut stress out of your life? You know what, hun? There are 2 different types of stress. There's eustress, eustress, eustress. Eustress is good stress. It is excitement. It is, oh, I get to do a support group meeting today. That's good stress because I like doing these. Or it is, I get to go to a movie, or we're having a baby. You know, that's stress, but that's good stress. Distress is damaging stress. That is when you lose somebody that you love, or when you have been fired from your job, or you know, you're kicked out of your apartment or whatever, something like that. And um gosh, I'm going way back to when I was in college. There's kind of a stress rating scale that, they basically say that you can handle that the human body can handle a certain amount of stress uh, every year before it takes a toll. But if you, for example, lost a couple of people that you loved in the same year and then lost your job and then you became chronically ill, et cetera, that's really a potential sign that it's not a potential sign. That's a lot of stress to absorb. That is a lot of stress to go through. And you are not Superwoman, and I am not Superwoman. When we are born, God didn't give us the skills to deal with losing somebody that you love, or facing a chronic illness, or dealing with pain, or just dealing with trauma in some respect. You have to go learn them. This is about skill building, hun. And so you can't cut all stress from your life. There's good stress in your life. It's all about what are you bringing to the table to learn how to manage your stress. And girl, you need to take a stress management class like I did. And again, a stress management class is and in a good anxiety management class is about skill building. It's not about going back in time and rehashing how your mother treated you when you were toilet training or whatever. It's about what can I do right now to help reduce the effect of the stress on my life. A lot of it will have to do with you recognizing stress early and acting early, not letting it build up. In some cases, good stress management is potentially walking away from a situation that upsets you, like my dad, who's a Trump supporter, who will occasionally just wax eloquent about the idiot. And I walk out of the room. I just cannot be in that room at that time. If I do, my blood pressure just goes higher and higher and higher. So we have to learn when to walk away. We also have to learn how to modulate the chemical reaction of stress in our human body. So remember, the fight or flight response is triggering the fight or flight response. You're getting a lot of adrenaline in your bloodstream. How do we deal with that? With deep breathing. What's that really good anxiety management tool is that when you have a negative thought, what do? Number one, visualize a stop sign. Just close your eyes for a moment, visualize a stop sign. Just stop your brain. It's like, stop it. Just stop thinking for a moment. Then you take a nice, slow, deep breath in for 3, out for 3. Right? In for 3, out for 3. And it's about diaphragmatic breathing. Diaphragmatic breathing. So when you're taking a breath, I don't want this to go up. I don't want you to go, that's not a good breath. You need to breathe like a puppy breathes. So when you breathe, right, and you're taking a deep breath, what we should see is your belly coming up. So you're going to go, right? My chest isn't moving at all. And it's interesting what a belly breath does to the pelvis also. Because the book talks about what it does. It opens something up or drops it. Anyway, I don't remember exactly what it does, but it's important. So getting that deep breath in is important because oxygen renders adrenaline chemically neutral, right? So stop sign, deep breath. Then in your brain, you got to minimize the thought too. You got to say, oh my God, Jill, you are not God. You cannot predict the future. It is a thought, it has no power, right? And that's exactly what I say to myself when I start to struggle with a lot of negative thoughts. I have to say that working with patients, some of you are like tornadoes. You're just like, I mean, so talking to you is like talking to me 25 or 30 years ago. Um, and that is, you're just spinning in stress. You're spinning in anxiety. It's just like, if I do this, the doctor will hurt me. If I do that, something bad will happen. If I do this, and it's like every other word that's coming out of your brain and out of your mouth when some of you are talking to me, it's just all stress generated and fear generated. And my job is to get you to stop spinning for a moment. And generally, what I say is, wait a second, wait, that hasn't even happened. We're not going to assume the worst, and if I can get you to stop spinning in that stress so that we can start taking some good steps forward. Some of you are afraid to go to the doctor. I know, because I was afraid to go to the doctor 25 years ago. It's like every time I went to the doctor, it hurt and I would have a panic attack. But I kind of got to the point where I couldn't live that way. And I went and took a class and I haven't had a panic attack since. So it's about skill building. John says it's not cutting stress out, but rather learning coping skills and mechanisms to deal with the stress and bringing your stress level down. Thank you, John. I went to a therapist. He says, I went to a therapist to learn skills which you use at home. There are also many self. John, dude, I wish you were sitting right here. Molly says, I got misdiagnosed with candidiasis. How do you spell that? How do you say that? Candidiasis. Candidiasis? What an ass. I was diagnosed in the ER with potential IC in January of last year. Doctor dismissed it as just an opinion. Loser. Mm. Erica says, my IC symptoms make me stressed on top of already being stressed. My symptoms are worse at night, and I already have insomnia. So frustrating. So I lose my, what, at night, especially. So again, Erica, you are an anatomical mystery to be solved. And so, what we have to do is really try to understand what is driving your symptoms, and specifically what is driving your nighttime symptoms. The reason why night times are often the worst is because you don't have the distractions during the day. During the day, it's easy to kind of ignore stuff. Whereas at night, you're just laying there trying to sleep, and you can't, because you feel everything. You're just wide open to whatever's going on. You could, you know, you hear the wind blowing, you just hear everything, right? Now, generally, Erica, I will tell you, the patients that I've worked with who have the worst trouble at night are patients who there's something in their daily life that's triggering them in some way. And if you're struggling with really extreme frequency, urgency, and pain, if you've got pain as your bladder's filling with urine that's relieved by urination, I really want to look at your diet and just make sure you haven't missed something. We all know to avoid cranberry. We all know to avoid citrus. We all know to avoid tomato, those common, acid things. But sometimes there's something that's quite innocuous that's triggering that constant daily irritation, like a vitamin. If you're taking a multivitamin, or I was working with a woman again last week who happened into a vitamin shop and just thought, I guess I need vitamins to fix all that. And they sold her hundreds of dollars worth of vitamins. And she started reading the ingredients off to me. And I was like, oh my God, don't take that. That's terrible. They don't know what the hell they're talking about if they gave you something with a lot of vitamin C in it or whatever. So I always try to figure out and look for daily stressors that would be triggering that constant nighttime irritation. Also, drinking too much alkaline water, or if you're using a Brita water filter, those are also known for producing more irritation. We don't, you know, eh, alkaline water is a bit of a fad. Uh, our goal is to try to be pH neutral to a certain degree. If you're drinking alkaline water all day, that's the equivalent of bleach, and bleach is damaging. Debbie says the detrusor muscle can cause frequency. Well, yeah, well, but I was talking about the pelvic floor, hun. The detrusor muscle is not part of the pelvic floor. We're talking about structures outside of the bladder that have the potential of triggering bladder symptoms. I could go through my notes here. Oh, here we go. Okay. So the adductor muscles are a group of 5 muscles located in the inner thigh and attached to the pubic bone. Trigger points in the adductors can cause deep pain in the groin and perineum, vagina and rectum, as well as urinary symptoms. So your tight leg muscles have the potential of triggering urinary symptoms. They are injured by overuse, a lack of warm-ups, falls or lifting, or arthritis of the hip, or Sitting with your legs crossed. Oh my God, that's what I do all the time. I want to invent a device that will prevent me from crossing my legs. Um, when the glute muscles are tight, trigger points in the glute muscles can cause voiding difficulties and destabilize the sacrum because the glutes normally work in tandem with the urinary sphincter and anal sphincter. Chronic glute tension, gluteus tension, and in other words, your most shallow muscles over your butt. Chronic tension there can create urinary and anal sphincter dysfunction, making voiding difficult. And these can also duplicate perineal pain. Anyway, I don't need to go through all those muscles, but I'm telling you, it's just stunning. The hamstring muscles, three muscles back at the back of the thigh that attach to the sit bones. Trigger points are common in runners, but if you sit for an extended period of time, compressing muscles or just in a bad chair, this can cause trigger points. Hamstrings contribute to SI instability, hello, that increases pelvic floor tension, which then affects the pelvic floor. All right. Kathleen, let's see. And what happens when all of a sudden at the age of 68, I start retaining my urine to the point of having to cath myself for a day? So, so Kathleen, so concept number one, remember urination is about relaxation. So muscle A relaxes and the sphincter opens. It's normally a very, very quick process. So if you've got super, super, super tight muscles, it's hard to empty your bladder and it's hard to have a bowel movement. But you might also have a nervous system dysfunction. You know, maybe the nerves in your bladder are not functioning normally. That also could explain urinary retention. If you've had a stroke, if you have MS, things like that, those also have the potential to change neurological function in the bladder, which have the potential of also causing urinary retention. Laylee says yoga has helped her a lot. Kathleen says diagnosed with IC on IC diet over a year and a half, no citrus. The urologist prescribes methenamine. I receive Parsons installation 2 times per week for over a year. I mentioned pelvic floor has no interest. So Kathleen, if he has no interest, that's fine. Go to your gynecologist and ask your gynecologist to check your pelvic floor. You know, I mean, remember urologists are not trained in muscles to any great degree. And that's something that we all have to fix in medical school. So go hit up your gynecologist. And some physical therapists don't require a referral. You might just be able to go to a physical therapist on your own and at least have them do a pelvic floor assessment. But if you're having any of the consistent symptoms that we see with pelvic floor tension, if number one, you cannot easily start your urine stream, or you have pain with intimacy, or you have pain not before urination but after urination, that points us more to your muscles as a potential source. And so it's important to have a pelvic floor assessment, see what they find. Grace says I have scoliosis, and the last time my curve was measured, it was 77%. Wow. Mine are in the 20s. Mine are 28. I also have severe osteoporosis and tried numerous treatments, but my body is so sensitive that I couldn't tolerate them. This book makes so much sense. Yeah. Juniper says, I have an insane amount of lower back pain. Why is that? Juniper, so you've got two muscles. So again, pelvic floor, you've got muscles from left to right, front to back, low to high. You've got muscles from the legs that come up and attach into the pelvic cavity, into the sit bones. And you've got muscles from your torso that come down and attach into your pelvis. Remember, your pelvis is the anchor, the buffer of your human body. It's what holds the weight of your abdomen, and it also is what deflects the stress and strain from you walking, the weight load of you walking. So you've got two muscles called the psoas muscles that go from the pelvis up your lower back. And the psoas muscles are really big, meaty muscles. They're big. You know, when you think about, you know, if you put your hands back on both sides of your back and you put your fingers on your spinal cord, right? Right. And I don't know if you can see me doing this, right? Okay, so like here's my spinal cord, and you've got from here to here some big meaty muscles, right? These are big meaty muscles. In that group of muscles is a deep muscle called the psoas muscle that's about this long and about this thick. And when that psoas muscle gets tight, it causes low back pain. But remember, the psoas muscle is anchored deep within the pelvis. So here it is. Um, so the two muscles that go from the spine to the upper leg, it can become contracted due to injury or prolonged sitting or stress. If a patient is bent over in pain, muscles contract, shorten, and may over time make it difficult for a patient to stand up straight. It disrupts the biomechanics of the pelvis as well as the lumbar, thoracic, and cervical area. It's known as a, oh wait, that's the wrong one. Hold on, I did the wrong one. No, that's kind of the right. I mean, that's one of them, but there's another one. No, that's the right one. Anyway, it's probably your psoas muscles. I'm gonna have to read the book 3 times. I can't wait to get to interview Dr. Weiss over the phone. I hopefully we're gonna do that this week because oh, there's so much information to absorb. Hmm. Joan says, "Guess I have to go back to PT." Yeah, probably, probably. I think so. Gigi says, I think we should tell our doctors about this book and have them read it. I think you know what you could do, so the promotional budget for this book is quite small because the doctor is retired and there's not a major publishing house behind it. It's kind of a small family affair with this book. It took him 15 years to write it. And so I've already volunteered to help them and do some promotions. I agree with you. I think every urology clinic in the nation should have this book. What I would really like to do is I would like to get him on video and do a series of educational videos for doctors and for patients on each structure. I think that that would probably be one of the best ways to educate the most people. And if you can afford it, I would give it to your doctor as a gift. I mean, seriously, I've been handing them out right and left. There, it's that important. Think about the number of people you can help if you're willing to, maybe just donate the book to your doctor and just show this chapter on this. Doctor, look, this is me. Lulu says, I had a hip replacement after a car accident 30 years ago. My pelvis was mashed on the left side too. They would not do anything for me at 30. The IC started. I had hip replacement at 46, still have a slight imbalance on my left side. So listening to you today has made sense. I try to do the best healthy. Yeah. Yeah. So Lulu, I mean, again, what he says is in the vast majority of IC patients he works with, he can go back and find some sort of trauma, if not multiple traumas over time. There might have been small traumas. You had one giant big trauma. But for many other people, it's just small traumas that accumulate and trigger points that eventually get turned on. Gigi says, so all these years on the bladder meds, we really didn't need the bladder in that you need to adjust our pelvic floor. Well, so basically what I'm saying is that the bladder medications might help control the symptoms, but they don't get to the root of the problem. They would not necessarily get to the root of the problem. Elmeron is a bladder coating. It's just a coating. It's a Band-Aid. It doesn't fix anything fundamentally. In fact, no bladder medications fix anything other than, say, an antibiotic if you've got an infection. The only, you know, um, for patients with estrogen atrophy, if you give that tissue estrogen, that's important because that will help those tissues produce more mucus. More of that vital protective layer, more of that gag layer that protects the bladder wall. But ultimately, in the end, if we don't just want to do symptom management, we want to try to solve the problem. We want to figure out what the hell's going on that's causing this long-term chronic symptoms. And one of my questions to Dr. Weiss was, you know, Is it fair to say that for a patient taking bladder medications, if they're not having any response at all, that it's time to look beyond the bladder? That the bladder is probably not the the key suspect here in those symptoms? Joan says, so now that we know it all goes back to muscle, do you still need the diet? Absolutely. Yes, you do need the diet because muscles in in a somatovisceral reflex are causing an overload at the spinal cord, a pain message, of neurosensitization, pain messages that you get overflow to the nerves in the bladder. The nerves in the bladder become sensitized. They become basically sick nerves, for lack of a better term. They start releasing substance P, which damages the bladder wall. So your bladder wall is damaged. It's just not caused by, the question is, why is the bladder wall damaged? For some people, it's because of chemical injury. For others, it might be due to estrogen atrophy. But for many of us, that key constant bladder wall damage is due ultimately to dysfunctional muscles and nerves that are overflowing back to the bladder in a somatovisceral reflex. Lauren says, is IUD insertion and removal traumatic? 2 months after that, I started having bladder pain, only had it in place for 2 months. I've never had an IUD myself. I think other people might be able to answer that question, but of some of the people and friends who have done it, some have said it's fine. Others have said it's quite traumatic. So, but we also have to consider the role of the hormones that you're taking, and if that could be part of the issue. If your bladder pain started 2 months after that, I would certainly have it removed, or talk to your doctor about maybe having it removed and seeing if the bladder pain goes away. I mean, if it walks like a duck and talks like a duck, it's a duck, right? And you had no bladder symptoms prior to the using your IUD. And so, if the IUD is playing some sort of pivotal role in that, the only way to figure that out is if you have it removed. Now, I'm not a doctor. I can't give you medical advice. What I'm telling you is go back to the doctor and have a discussion about it and see what the doctor has to say. Gigi says, I'll be honest, I do not like using the wand, so I don't use it, but I really should. So I'm going to go back to my physical therapist and tell her this and have her show me how to use it. Yeah, it's Gigi, girl, it is freaky. It is weird. It is odd. It is in a ultra sensitive part of the body where if you don't know the anatomy, you really don't know what the hell you're doing. And oh my God, there's a giant spider right here. Ew, ew, yuck. Big spider in my office. All right. Molly is going through a cancer scare right now. Molly, I'm so sorry, hon. Your bladder is honestly reacting to what is happening in the fear I'm experiencing. What do I do to relax my muscles? I would use a heating pad. I would get outside. I would go walk in nature, get in some nice, good oxygen. Try to release some of that stress. Remember, you're not God. You can't predict the future. For all we know, you may have tomorrow or when you have your follow up, it may be perfectly fine. And so rather than rehearsing the worst, let us just focus instead on today. It is where I am. It is a beautiful blue sky. I would get yourself away from the computer, get yourself outside, let sunshine give you some comfort and nurturing. If you can take a walk, take a walk. Girl, you have been through this before. You are a survivor. You are strong. You are dedicated. If anybody's going to be able to handle this is you, because you are truly one day older and one day wiser. I would put on some great music that you love. I would listen to Joel Osteen. Oh my God, yesterday I listened to 3 lectures from Joel Osteen that were awesome. Awesome, awesome, awesome. It was really about opposition. How do you handle people who minimize you and oppose you? And they were just so good. Erica says, is it reasonable that my last OBGYN refused to refer me to a pelvic pain specialist? I go to Kaiser. I tried to get a referral to the San Francisco Pain Clinic listed on the IC website. She told me I can only see a urogynec. What? I just had a. I mean, I've been working with them for a year for my weird vulvodynia that turned out to be tight pelvic floor muscles. Is it reasonable that my last OBGYN refused to refer me to a pelvic pain specialist? I go to Kaiser. I tried to get a referral to the San Francisco Pain Clinic listed on the IC website. She told me I can only see a urogynecologist. Well, hey, listen, if she won't give you a referral, I mean, I did it through my OBGYN up here in Santa Rosa. So if she won't do it, I call member services and ask member services to step in that you would like a referral. There's no reason they shouldn't deny that. If your local gynecologist is not giving you the relief that you need, if you're not responding to therapy, you have every right to ask for a referral. You pay them, they don't pay you. Maybe they're being penalized for making referrals. I mean, I'll tell you that my OBGYN was not happy with me that I asked for a referral. You know, that I think that she interpreted that as a failure of her care, and it was a failure of her care. She missed it completely. Two gynecologists said that it was vulvar eczema. She kept saying I had eczema on my vulva, and that's why I had pins and needles on my vulva. It wasn't that at all. What it was a compressed nerve from tight pelvic floor muscles. And speaking of which, so one of the things Dr. Weiss says in this book is as soon as you feel a zing, get up. He says, pay attention to how you're sitting. And if you have pain when you're sitting, look at your chair and move around. And I just had a little zing in my left side. So this is what we're going to do. I'm going to take a quick bio break, guys. It's time to go pee. Everybody go pee. And I'm also going to get to I'm raising my desk up so I can stand. Ooh, yeah. This darn SI joint is just annoying. Woo, magic desk, magic desk. Yes. I am no longer sitting. I am now standing and I'm going to go take a bio break. I'll be right back. Ow, ow, ow. Ow, ow, I'm back. All right. Bear with me one moment. Oh my God. Oh, tight legs. Okay. I am just living proof that when the leg muscles get tight, it affects your pelvis because damn, oh my God. I didn't stretch this morning. Oh. I wish I had a camera crew because I get on the floor and then I would show you all the stretches they tell us to do. All right. All righty then. All right. There is somebody speaking Asian, and I have no idea what that is. I don't know what language that is or anything. So whoever you are, I'm so sorry I cannot answer your question. Lulu. Okay, let's see here. Connective tissue is just important. Oh my God. Absolutely. Vicky, I lost my husband of 36 years in 2016, lost your job in 2017, classic IC symptoms 2018. I mean, it's interesting. I will say, working with patients for as long as I have, quite a few patients report that their IC started when their stress level is very, 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 very high. And again, Dr. Weiss explains that. What he explains is that if you have sustained a pelvic injury, you have trigger points that are latent, and all it takes is some sort of physical trauma or emotional trauma or stress. Remember, because when you're stressed, you're tucking your butt under, and you start pulling on those trigger points, and bam, there you go, the symptoms begin. Lauren says, you lost your father in 2011, joined the military. Thank you for your service. Went through boot camp in 2011. Symptoms started in 2012 after IUD insertion and removal. Lauren, I mean, again, remember, kind of ripple effect. It's a that so you probably had some early injuries, then you went through the deep trauma of losing your father, and then when you joined the military and when you went through boot camp, that took a physical toll and an emotional toll on your body. And physically, we have to think about how pelvic floor muscles could have been injured. Did you sustain any sort of direct fall or trauma, during boot camp? Penny says, some of us support our president. Let's not go there. I'm not disrespecting anybody. I'm just saying, Penny, all I'm saying is I can't be in the same room as my dad when he's doing that. That's all. That's not disrespectful. That's just me managing my stress. 97-year-old. John says, cognitive and behavioral therapy is a huge help for those of us dealing with stress. I highly recommend it. Courtney says, have you ever worked with anyone that had pudendal irritation from hypertonic pelvic floor muscles due to a mechanical hip ab weakness due to C-sections that the pudendal irritation resolved with the physical therapy? And the answer, if you go through his book, is he shares patient success stories with that. If so, does it take a little longer for the nerve to calm down once the muscles are relaxed? Absolutely. And there are, he has a whole section on how does he work with pudendal nerve. And let's see here. Let me go to this real quick. So let's see. Hold on a sec. So how does he treat nerve injury or entrapment? Number one, nerve blocks on the traumatized nerve. Here, hold on. I'm sorry. I do have to. My mic here is weird. So hold on. So he does nerve blocks on the traumatized nerve, either the pudendal nerve, the ilioguinal, the genitofemoral, or the iliohypogastric. Um, Sometimes he'll use cortisone and an anesthetic, limited to 3 per year. Or for sensitive patients, he'll use heparin and an anesthetic. Number two, he'll do nerve mobilization therapy, which is so one of the things he talks about is, when you bend. So look, so we know I've got nerves going from my hand up to my fingertips, right? And so when I bend them like this, well, what happens to the nerve? Well, the nerves slide, just like the muscles slide, the nerves slide. And it's that sliding that prevents that movement from hurting. But in some cases, the nerve gets restricted, but maybe by scar tissue, maybe by trigger points. And so he did nerve mobilization therapy, which is used internally or externally after a nerve block to release a nerve that isn't sliding normally. In the Alcox canal, as an example, due to scarring. He will hold the nerve against the sit bone, asking the patient to rotate their hips, which separates the nerves from the obturator. I mean, his depth, his skill level with this is nothing short of astonishing. He's so good at it. He will do some homeopathy for mild to moderate pain. He does believe in using a little bit of perhaps arnica. For drugs, he will do topicals, muscle relaxants, anesthetics, and agents to reduce nerve sensitivity, especially with vulvodynia. He'll use a topical anesthetic to desensitize the tissue or muscle things. He'll do lidoderm anesthetic patches in the area, which is which is a dramatic relief for strains, time release rehab, active for 12 hours. He'll use tricyclic antidepressants, low doses, extremely effective for nerve pain because they decrease the breakdown of serotonin and norepinephrine and relax the bladder smooth muscles. He starts with a very, very, very low dose and a gentle laxative because we know that antidepressants can cause constipation. He might suggest using an SSRI if anxiety is an issue, or SSNRIs. He does neurologics like Neurontin and gabapentin to diminish the transmission of pain signals between nerves. Ultram potentially. Believes in biofeedback. Podiatry to deal with any foot issues. Physiatry to deal with any musculoskeletal issues. Nutritional therapy to address dietary deficiencies, behavioral therapies. He says we cannot achieve a long-term resolution without addressing the emotional component to it. And that is true, my friends. Potassium tablets, no. Danielle says, what's the best type of water to buy? It's going to be a spring water, just a good spring water, Calistoga water, Arrowhead spring water. You just don't want to do Dasani. Dasani is like Pepsi Cola water. I don't remember the name of the company, but it just comes from a city. It's just city water. You want spring water that has good minerals in it. Annie says, can retention make me bloated like constipation? Do IC and IBS often go together? Can retention make you bloated? Listen, girl, if you have a distended bladder, a distended abdomen because you cannot pee, that is a medical emergency, and you got to get yourself to the emergency room right away because your bladder can rupture if it fills to a certain point, and so if you haven't peed in 8 hours, 7 hours, 6 hours, 4 hours, 3 hours, and you are in distress, you have to get to the emergency room immediately. That is a medical emergency. Do IC and IBS often? Yeah, they do. And they go together often because of the muscle component or the nerve component. If your muscles are tight and they're restricting blood flow to the bladder and they're impacting nerves and they're overwhelming the spinal cord, that's going to impact both the bladder and the bowel. We knew this a decade ago with a paper that was called the pepperoni pizza algorithm, where they were able to prove that if the bowel was irritated, the bladder would also show signs of irritation and vice versa. And that is how they introduced the concept of neural crosstalk between the bladder and the bowel. Wendy says, severe pain causes my muscles to tense up, which increases my pain. Meditation helps. And heat. I'm just really struggling with this on my left side, my SI joint. We think my ligaments are, I'm going to do prolotherapy. Oh God. Hey man, I'm going to give you a up-to-date discussion of going through prolotherapy because, so we think that my ligaments that normally hold the SI joint tight have weakened, and that it's probably an old athletic injury, and that now that my SI joint is so destabilized, my piriformis muscles and my obturator muscles are constantly struggling to keep that joint together. It's vibrating right now on my left side, like literally standing here. I can feel my muscles doing this. And so the next step is for me is prolotherapy. And my physical medicine doctor goes, Jill, I'm going to warn you right now, it's going to hurt like hell and it's really bloody. And I'm like, great. I'd love to bring my phone and cast that. I have no clue. Oh, I just want to get better. And my left pelvic area is just totally screwed up. Teresa says, given what you said, is there any reason to continue hydroxyzine? Also, my IC is worse from my seasonal allergy flares. That's exactly why you would want to take hydroxyzine. Hydroxyzine can help reduce the effectiveness, the impact of histamines on the bladder wall. That's the second part of that neuroinflammatory process. Is an irritated nerve releases substance P, which damages tissue, which causes mast cells to release histamine. And so using an antihistamine blocks half of that icky inflammatory vicious cycle that we get in our bladder. So yeah, hydroxyzine still makes sense. It's just context here, guys. This is just context. So when you're taking hydroxyzine or Elavil, I mean, are you expecting that this is going to heal your bladder wall or heal your bladder? The answer is no, it's not. What it's going to do instead is it's going to help control some of those secondary symptoms until you can get to the root problem, and the root problem is some sort of muscle dysfunction. Deborah says your OBGYN told you you have IC. I'm sorry, hun, but you're not alone. Tanya has scoliosis too. Yeah, I have scoliosis. I have an S curve. You can't see it unless I bend over. I think my computer's too high. See, like you can't see. The only way you can see that I have scoliosis from the front is that I've got one rib. I've got one rib that's slightly higher than the other. I have an S curve between here. So I've got a curve like this that goes like this. It's perfectly balanced, so nobody would know, but I'm supposed to be an inch taller. What's the name of the book? The name of the book, Breaking Through Chronic Pelvic Pain by Dr. Jerome Weiss. Groundbreaking. Joan said, your doctor asked you to read a book called How Not to Die. Oh, dear gods. Ashley says, what do you think of the neobladder? Well, listen, there comes a point where if somebody, remember we have subtypes. So I'm not painting a broad stroke in the sense that I'm not saying that every single person has a muscle dysfunction. I'm saying we think now a lot of you do, but some of you have Hunner's lesions. Hunner's lesions, also relate to nerves kind of running amok. And some of you might have scar tissue from repeated infections and other stuff like that. Generally, a really, really, really badly damaged bladder gets very stiff. Normally your bladder is like a balloon and it kind of opens and closes and opens and closes. But when the bladder wall gets scarred, it cannot open. So your capacity stays small. And for some people, again, they might have been dealing with chronic infections, whatever. Their bladder is diseased for one reason or another and gets very, very small, and that's when they would consider bladder removal. So Ashley, I'm not sure if you're talking about, I'm not sure how you're using the word neobladder, to be quite honest. If you're talking about them creating a section of bladder out of bowel, doing an augmentation surgery to expand your bladder, or removing your bladder and making a little pouch with bowel tissue, is that what you mean? John Paul says, I believe I have all the subtypes and you treat all. I understand. I don't think, well, one of the questions I have asked Dr. Weiss is what does he think causes Hunner's lesions? It's going to be interesting to see what he has to say. Bernadine says, I've been using a Brita filter thinking it was better than city water. Yeah, no. Brita filters are kind of notorious for producing pretty irritating water. It takes out too many good things. It takes out the pH balancing minerals, so you end up with acid water. Tanya says, my compounding pharmacist says that we need testosterone along with estradiol for estrogen atrophy. I don't want to delve into total hormone replacement, even if it's just a cream. I get side effects even with estradiol. Yeah, it's kind of, I mean, there's a lot of differing opinions there. Daniela, I don't speak Italian. I'm sorry, I'm not quite sure what you're saying. Let me put it through a translator. Daniela, there is an Italian ICA that does work with IC patients, and the name, oh, what's the name of the leader will come to me. What is her name? Kathleen, I did not know that bladder irritations could be caused by a Brita water filter as well as alkaline water. What water is suggested to drink? A spring water. Just a plain spring water, what you would find in nature, not a chemically modified water. So I drink Arrowhead water or Calistoga water here on the West Coast. Just look for a good spring water. Some people really like San Pellegrino. It's just kind of expensive. We just don't want you to do something like Dasani water. Look for a spring water. Angie said she just got her book. She just started chapter 5. Can't excited to share it with her medical team. John, spring water is perfect for IC. Ruby says, my childbirth in 2000 left me in a lot of tailbone pain. Doctor just kept telling me to take ibuprofen. Could that be causing? Absolutely. Ruby, I have to tell you, we have story after story after story of patients who have sustained tailbone injuries. And that is the absolute typical triggering event that we see in patients with many patients with chronic pelvic pain and IC. I have a really good story of a patient story in our patient magazine from last year, and it was fascinating because it was a woman just like you, diagnosed with IC. None of the bladder therapies helped her at all. And she attended one of our events and learned about pudendal neuralgia and decided to research a little bit more about it. And as she learned about pudendal neuralgia, what she saw was that, yeah, she felt that she had all the symptoms associated with a compressed nerve. And so she had that confirmed with one doctor, and the doctor went, do you realize that your tailbone is crooked? And her tailbone was crooked. And she had to undergo quite a bit of chiropractic therapy to try to get that eventually got her tailbone, that bony structure, in the correct position. But we see a lot of tailbone injuries. And so that does not surprise me at all. So you need to have a pelvic floor assessment, get an idea of what's going on with your muscles. But it would also be very interesting to have an x-ray and just see what's going on with your tailbone. Is there any abnormality? Did you break the tip off? Did it heal back crooked? Anything like that? Does it have the proper curve? The tailbone injury is classic. Tyler says, I had a cystoscopy and it showed nothing. I believe I have pelvic floor dysfunction. Absolutely. And you're probably right, Tyler. Well, if you don't have, so remember that your bladder wall it is influenced by multiple factors, and it's a fairly complex organ. You have a lot of nerves in your bladder wall, and so it may be that you've got some central sensitization. So the theory behind that, and Tyler, let me just say this: the vast majority of guys that I've worked with, I almost always find a triggering event, some sort of trauma, whether you were a paratrooper and you were jumping out airplanes and had a couple of bad falls, whether you're a football player, whatever, whatever, whatever. Okay, we usually find some sort of history of muscle trauma in these patients. So so you at some point in time there was an injury, and the nerves in the area, the nerves in your pelvis were traumatized, and those pain messages overwhelmed your spinal cord and basically caused something called neuroplasticity. And in neuroplasticity, that's nerves that are kind of responding to pain in either a good way or a bad way. If you, for example, lost a hand, uh, um, the nerves have to that's not a good example. A spinal cord injury where we know slowly the nerves can regrow to do the same function. That's kind of an example of neuroplasticity. There can be negative neuroplasticity too. And so generally what we see is some localized sensitization of those tissues. So what that means is that the nerves in the bladder wall become much easier to provoke. And so even though your skin is healthy, the nerves underneath that skin are uber sensitive. And so, as an example, I have had vulvodynia. My skin looks entirely normal, and yet it looks like somebody. I mean, it looks normal, but it feels like somebody's rubbed the skin off with sandpaper. The nerves are that sensitive. So the odds are you probably have some neurosensitization going on. So the irritation of the coffee would be damaging. You might also have some microscopic damage to the bladder wall, nothing that's critically visible. You don't have a big wound, but you could have some smaller wounds from those irritated nerves releasing substance P, et cetera, which would explain diet sensitivity. Libby, what if you're allergic to lidocaine, then do marking? Joan says, I get superior hypogastric plexus nerve blocks every 8 weeks. Had one last Wednesday, and you were in high pain. Well, and you still have pain. Do you still have the same amount of pain? Did it improve at all? I mean, is there any chance that they missed the nerve? Vicky goes bloody. Yeah, he told me it would be bloody. Ivan, I have no idea what you're talking about. What is my piece of? I have no idea. Angie, please let me know how prolotherapy goes. My doctors have recommended it. Insurance doesn't cover it, but my insurance changes next month. Maybe they will cover it. But I don't know after what you just said. I don't know either. I'm going to have a phone consult with him. Tyler said, I know antibiotics help me. I've been told that it's because they're an anti inflammatory. But if that's true, why do NSAIDs and prednisone help me? Why doesn't? When I get tested for UTI, nitrites and white blood cells show for infection, but when they send it to the lab, it comes back no bacterial infection. Well, listen, if you're showing nitrites, you have infection. If they're doing a urine strip test, a dipstick test, and you're showing nitrites are only produced by infection, by bacteria. So if you're positive for nitrites, you have infection. What it means is that the urine culture they're using is not specific to the infection that you have. So you need to do next generation urine testing to figure it out. That would be the next step. Yeah, because most IC patients, we might test positive for leukocytes from a damaged bladder wall, but we usually don't test positive for nitrites. So if you've got a double positive nitrites leukocytes when using a dipstick test, then that's absolutely, compels a next level of testing. And that would be this next generation urine testing, bladderhealth.org. Go over there. You can watch a bunch of videos of doctors who use this to diagnose weird infections. A urine culture is limited by the growth medium. And so whenever they do a urine culture or they do a petri disk, they can do it in a test tube or they can do it in a petri disk. They always put a growth medium in there, and the growth medium will only grow out the bacteria that feed on that specific medium. And you've got aerobic bacteria, anaerobic bacteria, you've got fungi. And we now know that typical urine tests are remarkably ineffective. If we really want to know what the hell's going on in your bladder with respect to infection, this is how you would do it. You would do next generation urine testing. And you can order it by yourself. In many states, you don't need to have a doctor referral. And it's a very interesting piece of your puzzle. I don't like guessing, Tyler. I like facts. And the fact is that you have positive nitrates, and that tells us infection is going on. And I'm not so worried about a typical urinalysis not coming back, because typical urinalysis are flawed. This is going to reveal if you have any dysfunction in your bladder. Next generation urine testing. This will grow out 95% more bacteria. I mean, it doesn't grow out anything. It tests for the DNA of your urinary biome. It will tell you good bacteria, it will tell you bad bacteria, and it will tell you if you have any fungal infections. So I would do this, Tyler. Then you'll know once and for all. Joan Ball says, so the comment about scoliosis, my daughter has it. How do you propose early treatment to haunt muscle nerve crosstalk? Well, I think a lot of it has to do with muscle health and body health. I know for me, when my scoliosis started, everything hurt. I mean, I was 13. I used to love to sew. I couldn't sit at the sewing machine and I couldn't bend over like that. It just hurt too much. And I couldn't, going to bed was hard because I would feel that going from sitting on the side of the bed to laying flat, I could feel my spine settle. And it was just awful. It was just like this 30 seconds of excruciating pain until things stabilized. And anytime you work with orthopedic surgeons and orthopedists who specialize in scoliosis, they're always talking about muscle health. And ultimately in the end, your spine is supported by muscles. I think one of the reasons why I developed scoliosis is because I was a fat kid. I was pretty fat. I had ginormous boobs for that age. I had 38 double D boobs when I was 13. I was chunky. And I had one 6-inch growth spurt the year before. I was one of the tallest kids at my school. And then I had my next growth spurt. And I literally just don't believe that my spinal cord could support my grandmother's boobs. If you could have seen my grandmother Betty, who is, God bless her soul. I mean, we're talking watermelons. And uh I just intuitively for me at a very, very young age, I felt that my weight was playing a role in my scoliosis. And so I started playing tennis, and I became a professional tennis player, and I started swimming. And they always say that, and I did physical therapy too. They sent me to, I can still do today the physical therapy exercises they gave me back then. And that was involved kind of stretching out the tight muscle and the tight side of my curve, and then uh, um, tightening the outside of the curve, right? Because you got an outside of the curve and the inside of the curve, and the inside of the curve is tight. The outside of the curve is a little overstretched. So I think muscle health is really, really important. And then looking at the biomechanics. I mean, if is your daughter walking normally? Is it how is that influencing her pelvis in any way? I mean, she's not having symptoms now, and that's good. At least I don't think she is. But if I could go back in time, well, I've said it many, many times, if I could fix just one of my health problems, it would be my scoliosis. I would love to fix this curved spine. I wish I could have a magic wand and just woo, stand up straight and not have a curve in my back. Nancy says, "What about the Santeria water filtration?" I don't know, hun. Tyler says, "I drink essential water because it's a high pH. Is that okay?" No, it's not, Tyler. I mean, if you want to do it once a day, that's fine. But I mean, so when I got my chemistry degrees and I worked at a lot of lab work, right? What did they teach us? Bleach will eat your eyeballs out just as quickly as sulfuric acid will. That's like a direct quote from Mr. Bailey, my chemistry teacher in college, my first year. And so we always wore protective glasses. Why? Because sulfuric acid, of course, is extremely damaging to tissue, but so is bleach. And bleach is the opposite of acid. It's extremely alkaline. And if you've ever spilled bleach on your hand or your fingers, it gets very, very slippery because it's literally dissolving your skin. And so I do not support drinking alkaline water all day. I was at a food show looking for stuff for IC, and somebody had samples of alkaline water, and I tried it, and it stripped all the mucus out of my mouth. And like I knew immediately, oh hell no, I don't want to strip all the mucus out of my bladder. Oh my God. Our mouth and our bladder needs that mucus. That plays a critical role here. So I would let that go right away. One a day at the most. And followed up with regular water to rinse to get it out of your body. Joan says San Pellegrino has carbonation. You can get San Pellegrino still water rather than sparkling water. Kathleen says, I believe the IC diet does not recommend carbonated beverages. You're right. You're right. It's the IC diet, of which basically we helped to develop years ago. Certainly don't want you drinking soda. Why? The dominant problem with carbonated beverages really isn't the carbonation, it's the acid, the citric acid used for flavoring combined with the caffeine. And so it's the carbonation itself, it only adds a tiny fraction of acid to it, and that's through carbonic acid. But compared to the massive acid for flavoring and the caffeine, many patients can do a plain sparkling water just fine. I drink sparkling water all the time, and it's never flared me, even when my bladder was a mess. And listen, if you live in an area with good tap water like I do, tap water is fine. Angie says the three C's: carbonation, citrus, and caffeine. That's a good way to think about it, but there are also degrees of acid. One of the things I say to patients is think about it. A cup of tomato sauce represents the acid of about a dozen tomatoes that have been squeezed and cooked down. That's a hell of a lot of acid. One thin slice of a tomato on a sandwich has much, much, much less acid in it. So it's about the quantity of acid that's far more important. And so many of you, yeah, you can't do tomato sauce. It has the potential of irritating your tender bladder. But can you get away with a slice of tomato on a sandwich? You might. A lot of people do. I do. And man, we're getting ready, starting to plant our spring gardens. So remember, if you have a vegetable garden, start and pick out some yellow tomatoes. Do some of those heirloom big yellow or the yellow orange tomatoes are much, much less in acid than the red tomatoes. Hi, Karen. Joan says Google says the plant adds carbonation. It is acidic with a pH about 5.6. Yeah, carbonic acid. Okay, but that said, you know, it's about the quantity of the acid. And so a soda is going to be a much higher acid level, that's a lower pH compared to simple sparkling water. But ultimately, in the end, everybody's different. What works for one person doesn't work for another. It is your job to find the diet that works for you. Let's go down to YouTube here for a moment. Hello, my friends on YouTube. All right, let's see what's happening here on YouTube, and then I will come back to Facebook. Becky says, "Can you make an video or podcast of the interview?" We'll see. I want to do that. I will certainly have a big transcript of it, no doubt about that. Okay, so hold on a sec. God, you guys have been busy. All right, hold on. Becky says, "What is bad about a Brita filter is it takes out all the pH balancing minerals, so you get acid water." Nana says, "I get a dull ache above the pelvic bone, which plateaus after a while, typically after eating the wrong thing. Is that pelvic floor related or just due to the lack of estrogen?" Um, Hannah, I don't know. I mean, you have to have a pelvic floor assessment to see what's going on. You've fallen, you have 5 children, 2 C-sections, dryness, atrophy, estrogen atrophy, which is you believe is half of the reason you have IC symptoms. I mean, that pain, that if the pain is right behind your pubic hair, like literally right there, right really low, then that's your bladder. So that would tell us your bladder is an issue. If your pain is higher up by your belly button or below your belly button, then we're going to be looking at muscles. And Nana, I would hope that you're using something like coconut oil on your skin down there, right? If you can't use estrogen creams because of side effects, coconut oil might be a good way to give yourself some moisture, because dry mouth hurts. When you have dry mouth, what do? You turn to drinking water. Well, dry vulva hurts. And so getting some moisture back in those tissues is important. And the best way to do that is with a coconut oil. Or this is something that we have in our store. It's called V Magic. And it's very popular. It is, let's see, let me tell you what it is. It's an intimate skin cream. It contains extra virgin olive oil, organic virgin avocado oil, beeswax, honey and propolis, and sea buckthorn. And the sea buckthorn, I think, is really important. That's known for being very, very calming and soothing. So for women who struggle with super, super dry skin down there, V Magic is definitely an option to try. It has a good consistency too. I don't want to open that one. Here, hold on a sec. Hold on. Let me. Okay, so let's look at this for a moment. Here's mine. So it's very you know, it's not as oily as Vaseline. It's not sticky at all. I have to tell you, it really, it's about as close as I've ever seen of a product mimicking normal moisture for your skin down there. So I think V Magic is certainly an option. Um, and then just out of curiosity, so this is coconut oil, right? So This is an extra virgin coconut oil, and this is what I use sometimes too if I'm feeling dry. And so you can see, because it's cold, the coconut oil is white, and you put it on your skin, and then you just rub it with your fingers, right? And it very quickly melts. And so you see it's melted now, and it also becomes, it just works beautifully on your skin down there. Here, hold on. Now I got to go wash my hand. Hold on. Alrighty then. Sorry about that, but if I didn't wash my get the oil off of my skin, I'd have oil marks everywhere. All right. Frank says, I don't know why I'm here, but it seems like it's a help. Frank, I'm happy to help. If you got any pelvic pain, prostate issues, you're in the right place. Nana says, Becky, I feel like death. Oh, honey. Karen says, would burning after urination be caused by muscle nerve? If you have burning on the skin, so literally as you're peeing, if the urine crossing your vulva is burning, that is estrogen atrophy. If it is a deeper pain, a burning pain that is kind of in your vagina and other areas, then that would point us more to your pelvic floor. But if it's just right on the surface of your skin, the burning is right on the surface of your skin after you peed or while you're peeing, then that tells us the quality and health of your skin is challenged in some way. And so we're really going to be looking at estrogen atrophy there. Grace, I've had pelvic floor physical therapy twice with overactive bladder, and when diagnosed with IC, I was not told I had tight pelvic floor muscles, but it does take me several seconds to begin urinating. You're confused. Grace, if they sent you to pelvic floor physical therapy, it was because your muscles are tight. Normally you have a pelvic floor assessment, and they at your first appointment, and they tell you which muscles are messed up, right? They will tell you, is it your piriformis, is it your levator, is it your obturator, is it your psoas? They will give you a clue which muscles they're working with. But the fact that it takes you several seconds to start emptying your bladder means your muscles are tight. So two sessions with a pelvic floor physical therapist is nothing. That's a drop in a bucket. I would, if I were you, go back to that pelvic floor physical therapist and ask really specific questions. What do you feel down there? What do you see down there? Is it dysfunctional on the left? Is it dysfunctional on the right? Do you see any explanation for why this would be happening? Okay, does Dr. Weiss have anything in his book regarding adhesions being attached to anything in pelvic? I don't believe so. Becky says, I don't want to buy water in bottles. It's bad for the environment. How can I make tap water okay? Well, your tap water may be fine. You might not need to change anything. Wasim says, do you think ankylosing, is that how you pronounce ankylosing spondylitis could cause chronic pelvic pain syndrome? Hold on a sec. I think so, but let me go to. I would say yeah. Um, and I do think he mentions it. He doesn't talk about it in depth, but he does talk about arthritis in hips as being a triggering event for muscle dysfunction. And and so there is a potential case for that. And it would be very interesting to work with a physical therapist and see what they see with respect to the health of your pelvic floor muscles, Wasim. Kay says, good question, Becky. I have well water where I live. I want to know how to make it safe. Honestly, if you have well water, what I would just do is have your county test it. I mean, because the biggest issue with well water is contamination, either bacterial contamination or contamination from nearby farms using pesticides or gas stations using oils. And your city or your county usually offers free water testing to test your water. That's what I would do. I would have your water tested first. And I agree with you, Kay. I cut way back on buying bottled water. Way back. Nana said, my pain is between the pubic bone and below the navel, but it is helped considerably by Mirbitric, which is a muscle relaxant, desert harvest aloe, to the point that it's not noticeable sometimes. So then again, we can look at the quality and health of your skin. Hon, listen, it's the chicken or the egg dilemma. Which comes first, the chicken or the egg? And for us, it's which comes first, the bladder or the pelvic floor. The reality is that they're both involved because they are so incredibly interconnected. So you have both issues. Listen, you had a lot of kids. You had two C-sections. Your muscles are not the muscles that you had before you had children. Your muscles are weaker now and potentially traumatized now. And I think you also said that you'd sustained some sort of trauma. So your muscles are part of this mystery, but the other part of this mystery is the health of your bladder wall due to estrogen atrophy. So it's not one or the other, it's both. It's both. And the fact that aloe is calming and soothing is great. The fact that Mirbitric is helping you with some of your frequency urgency is great. But that you cannot discount the fact that your muscles have been traumatized many times, right? You just can't do that. Len says, has anybody used an IC specific car seat cushion? And if so, would you recommend them? Len, I will tell you that our bladder and prostate friendly chair cushion was brought to us by physical therapist Lisa Icavelli 20 years ago to my local support group. And she was the one who introduced the bladder and prostate friendly chair cushion that you can find in our shop. We've sold thousands of those cushions in 20 years. And he talks about that in this book. He talks about for patients who have pain with sitting, that we have to be much more attentive to what we're sitting on, and using a cushion to protect that pudendal nerve is critically important. And so if you could see, let's see here, hold on a sec. Let me just show you. I am always testing cushions. So this is a cushion that I just bought about a month ago. Don't buy it. Didn't work. Of course, this is the what do you call this? The waffle cushion. This cushion is very popular for people who have glute pain. You're not pain in the crotch, but pain in the muscles, and you don't want to sit on anything hard. This is the cushion that I will turn to when I have those moments. Hold on. Let me just get them all down. Dude, you should see all the cushions in my garage. I have bought every cushion on the market looking for these. This was a cushion that we tested. This is the if you can see it at an angle. Yeah, don't buy it, doesn't work. This is our bladder. This is a test, one of the tests for our bladder and prostate friendly chair cushion. And you can see, let me just take it out of the cover. Take it out of the plastic. So here is the cushion. So each butt cheek is supported, but there's nothing pushing up against anything in your crotch. So if you've got vulvar pain, if you've got urethral pain, if you've got prostate pain, rectal pain, this is the cushion to sit on. Um, the challenge with these could, I mean, so we had four cushions based upon weight, and the manufacturer has just said they will no longer make us four cushions. They were being custom made for us. So we're going back to two cushions, a 2 inch and a 3 inch medium cushion with our next order. So, and these are cheap cushions. These are cheap cushions. These are like the cheapest ones for our purpose. So these are going to be in the $20 to $30 range. You'll get 3 to 4 months out of it. Every time you sit on it, you push a little bit of air out of the foam. So it's just going to get flatter and flatter and flatter. And so, if you get 6 months out of a cushion, great. If you're heavy and you're putting more weight on it, it's going to get flatter quicker. It is what it is. These foam cushions do not last very long, 3 to 6 months. Now, hold on. The Cadillac of cushions is this cushion, and this is made. We just started carrying these. I've wanted to carry these for over a decade, but they just didn't have, a good program for us. This is a cushion that's in the $80 range, but you'll see so it has a groove down the middle, and you can flip it. So if you got pain up by your urethra or your prostate or your testicles, you can turn it one way, or if you've got rectal pain, you can turn it the other way. This is a much better cushion. I'll be the first to say this puts this other cushion to shame. It will last longer. The foam is a higher quality. We also have a travel one that folds up in two. And where is it? Come on, where is it, Jill? If you go over to our website, here, hold on. You'll also see this fabulous travel cushion, which looks like our cushion but has handles on it and folds up. And that's the one that I carry in my car. So when I want to go work at Starbucks or something like that, and they only have metal chairs, I will sit on that cushion. So I'm going to tell you right now, cushions work really, really well. And I would absolutely give it a try. We haven't raised the price of those cushions in a decade because they're just so important for patients to use. Nana says, can antihistamines have a negative impact if estrogen atrophy is not yet corrected, adding to the dryness? I had a bad episode after 2 doses of Claritin. I don't think so. I've never heard of an antihistamine making the bladder wall drier, but an antihistamine can make your mouth drier. What a great question. I don't know. I took antihistamines when I was in my early 30s and had ovaries. That's a brilliant question, Nana. Brilliant question. All right, let's go back to Facebook here. Hello, Facebook. Nice to see you. All right, let's see. What have you guys been up to while I've been down on YouTube? Tyler says, regarding your comment to men with muscle trauma, it's true. I had a very bad car accident and back fusion. There you go, dude. There you go. There you go. So with the back fusion, I would imagine that number one, what you probably have is um, muscles that are number one, they've been traumatized. Number two, you probably have quite a few latent and or active trigger points. God forbid you have a career that requires you to sit for a long period of time or drive for a long period of time. You are kind of the perfect example of what happens to the pelvis with recurring injuries. And Tyler, if you're still in here, and I really hope you're still in here, I really, really, really need you to to not beat yourself up about this. You were hurt. Everybody out there, every single buddy watching this is not your fault. You have done nothing wrong. No shame, no blame in any case. You have a physical traumatic injury. And yeah, you know what? It would have been a lot easier if it was on your shoulder or something like that where, people could see it and understand it. It sucks that it's down in the private area and it's not easily seen. It's inside of your body, but you're still injured. And you are now on a journey of healing, and I don't want anybody to minimize you, but more importantly, I don't want you to minimize yourself. This is not your fault. You've done nothing wrong. No shame, no blame, okay? Elaine says, "What if you have protein and high specific gravity on a dipstick?" You know what? That's beyond my purview. I know if you have a lot of proteins in your urine, that's a sign of other diseases. That I do believe that sometimes they see that with anorexia. That's a sign that your muscles are basically being consumed for nutrients, and that can result in a higher protein in urine. But there can be lots of other contributing factors. That, my dear friend, is a question for your doctor. Trudy says she lives in Charlotte and was referred to Dr. Evans in Winston, and that he's great. Yes, Libby, I've heard of that blog. Deborah says, "You never had to wear a brace, Jill. Both my sister and daughter had scoliosis discovered at school. I tested clean at school for the test. They found it in an X-ray 4 months after it was clean, which means it was a big growth spurt for me. And my two curves originally were quite bad. They were in the high 40s, almost 50%. And we went down to Stanford Children's Hospital, and the doctor down there scared the living hell out of my parents and said that there was a 50% chance that I would come out of a fusion surgery paralyzed. And so my parents opted not for me to have a spinal fusion. And my doctor at the time up here in Santa Rosa was just a freaking jerk. And he kept saying to stay in bed. If it hurt, just lay down. And the problem is the more I laid down, the worse it got. And that makes sense because the more you lay down, the weaker your muscles get. The weaker your muscles get. And so I just intuitively did exactly the opposite of everything he told me to do. Instead of laying down, I went and got active. I walked. I played. And that's how my curve got better as I strengthened my muscles. And so my curves are now, I think, in the 23, 20, 22, 23% air range. And that was just simply from fitness. I was a TV baby, guys. Listen, when I was in junior high, I did not play. I mean, I was not playing sports in elementary school. We didn't have soccer back then. I'm an old woman in that sense. We didn't have soccer in school. The only thing we had was kickball, and there were no sports for girls. And so, I was a roly poly kid with big boobs and who sat around and watched TV and played piano. And when this all happened, I just knew I had to get fit. Pretty smart for a 13-year-old. Tyler says, "When I get a bad flare, I drink baking soda and it helps. Is this bad?" Well, Tyler, you just have to remember that baking soda is sodium chloride, and sodium can make your blood pressure increase. And so, if you want to do a quarter teaspoon of baking soda in a glass of water once a day, that's usually not a problem. But if you're doing like a teaspoon or a tablespoon several times a day, that is absolutely a problem. It would be much better for you to use something like Pre-Leaf. Pre-Leaf is a dietary supplement based on calcium glycerophosphate, which can neutralize reduced acid in your stomach, but it doesn't cause the change in blood pressure that baking soda would. And they are, as I should mention, the sponsor for our life support stream. So Pre-Leaf has been around for about 30 years. It was developed by Alan Kligerman, DSC Healthcare Solution. No. AK Pharma. He's the guy who also invented Beano and lactate, and he invented Preleaf. And Preleaf has been around for many, many years. Thousands of patients use it very, very successfully so that they can enjoy some foods that would normally irritate their bladder. And so we want to say a big, giant thank you to Preleaf for being there for IC patients for 27 years. And I mean, for me, it started 27 years ago. From day one, Preleaf was there. This product is really good. But you know what? You don't eat it like candy. It's calcium. The calcium's got to go somewhere. You only do it before a meal, a risky meal. I mean, if you don't eat pre-leaf or any of these supplements like candy, if you do, you're going to get too much calcium and you could potentially throw kidney stones. Kathleen said, it's difficult to find low acid tomatoes here in California. Yeah. Molly says, I drink ginger ale. It doesn't hurt most of the time. You know, that Molly, power to you. Ginger ale always bothered me. Kay says, I have a whole house water filter, just charcoal. Are you saying this isn't good to drink? I hate chlorine tap water. Kay, no, I'm not saying that at all. What I'm saying is we want to just try to have pH neutral water. And so I would get some pH test strips and just test your water, see what it's coming out as. Just out of curiosity. For all we know, it's perfect. And it could easily be perfect. So why not? Kathleen says, I will not drink tap water because E. coli was found in the water system in Denver a few months ago. You know, listen, water is not, the human body is not sterile. We have an abundance, trillions of bacteria living in our body, good bacteria and some bad bacteria that help us process food and digest food and produce, all sorts of things. I don't think you need to be afraid of bacteria. You just have to, and I would be a little bit more afraid of giardia in water. Giardia in water is really devastating. But you're pretty much going to find E. coli on your skin anyway. I mean, I agree with you. Would I drink water where I know there's a big population of E. coli in it? No, I wouldn't. Colleen says, I just got discharged from pelvic floor therapy. I still have pain on the right side of your vagina and have trouble sitting. She said your pelvic floor is okay. Do you know what that could be? Well, so Colleen, maybe you're like me. Maybe you've got a bony structure issue. Maybe you've got your SI joint on your right side isn't it is unstable, or maybe you've got a nerve that's being compressed somewhat, or maybe you have a fibroid tumor in your uterus. So I think you go back to the doctor and you say, okay, the pelvic floor physical therapist says my muscles are fine, but I still have pain on the right side. What could this be? Could I have a fibroid? Could I have an ovarian cyst? Could it be my SI joint? Could it be something like that? Okay. Joan says she always uses heated seats in her car. You know what, Joan? I did that and it gave me a yeast infection on my vulva. But I was taking antibiotics at the time. But I sleep with a heating pad and I will wear these. These body heating pads are the bomb. These are so good. And so what you do, so remember, this is how big it is. You just open it up, right? And look at how thin it is, right? Look at how thin it is. You just peel off the back and that turns it on. And it takes about an hour to heat up and then it will last about 8 hours. So I'm going to put mine, well, you can't really see. I'm going to put mine right there, like right at the top of my glute. You can put, you don't put it on your skin. You can put it on your underwear. You put on your underwear right there, or you can put it right there. When I travel, I will always bring a healthy supply of body heating pads. And there are times when I wear three. I will wear it up my left side, one here, and one here. Tanya had 3 C-sections with a vertical incision. Girl, my worst muscle problems. Woo! Yeah, the vertical incisions are definitely the most traumatic incisions. And it would be interesting, Tanya, do you have any sensitivity along your scar? Is your scar sensitive? Or more importantly, if you roll your scar, is it sensitive underneath the scar? Molly says, talking about cushions, what about a good old fashioned donut cushion? Donut cushions are the worst cushions to use because think about it. You know, if you're sitting on something round, you're putting kind of an abnormal torque on various muscles and nerves down there. Kind of, I never tolerated a donut cushion well at all. Whereas if you're sitting on a square cushion with a groove down the middle, you're not, you're separating from the left and the right. You're not kind of putting weird physics, for lack of a better term. I don't know the right word to use here. So the donut cushions just really have never been appropriate for the type of pelvic floor that we tend to talk about. Denise says, "Hi, Jill," from another Jill. Charlene says, "Sorry if you have addressed this already. I'm at work and just catching some. Does Dr. Weiss give solutions for you to do at home?" He does. But my pain is constant. I can hardly get into my car because it triggers such bad pain. No quality of life. He does, but ultimately, Charlene, it still is about having a really thorough examination of your pelvic floor, looking for trigger points, looking for signs of a pudendal nerve entrapment that would help us understand why sitting in a car is so painful for you. Tanya says, confused about a reverse osmosis water. You're testing it at a 7. If you're testing it at a 7 pH, that's great. Just understand that I don't does osmosis leave the minerals in or not? I don't remember the chemical process for reverse osmosis. Distilled water is not considered good because it doesn't distill the minerals, and we need the minerals. So hello, good morning, Susanta. Kathleen, is it possible that I may be moving to Walkersville, Maryland in June? How would I locate an IC specialist? We have a database on our website that you can search. It's quite old. I'm only adding one doctor's randomly. I just haven't had the time and the staff to update it. So I have about 200 new names to add. Just the life is busy. I haven't been able to do it. Libby says, I'm sorry, Jill. I just wanted to know your opinion and thoughts on the sacroiliac ligament block. Hun, I just don't know. I don't know. I don't have an opinion because I'm not exactly sure what that block accomplishes. Kay says she ordered the heating pads for her Florida trip. They worked wonderfully. Yeah, awesome. Tanya says her scars are not sensitive. Your last baby was born in 1979. Awesome. That's good. However, the reality is that you don't have the pelvis that you used to have. And now you're older, you're menopausal, and we know with the loss of estrogen, your pelvic floor muscles have a potentially to be weaker. I can definitely feel my muscles changing a bit. I can't do the workouts I used to do at all. And it's when I go to the gym and try to work out, half of the time I end up hurting myself and I don't even know why or how I've hurt myself. It's ridiculous. Colleen says, what's the website to order? Colleen, if you can just go to our website, icnetwork.org, and click on shop, and you'll go right in there. And just know we still have some of the 4 blue cushions, 2 of which are being discontinued by the manufacturer. So get what you can now, and we will not be able to get the I think it's the 2-inch soft. Well, they're not letting us buy soft or firm foam anymore. It's all medium. So that's the way it was 20 years ago. Is that they were all medium, and then they gave variants, and now they've just gone back to medium. Frankly, we love the old medium cushion, so hopefully they'll be that good. Tanya says, yes, my core is not strong now in my 60s. Girl, you got that right. Mine isn't either. All right. All right. So listen, we've been going on for about 3 hours. I don't know about you, but you know what? I kind of would like to go watch the last part. Is the Daytona 500 over? I normally growing up watched all car races with my dad. Hold on a sec. Let me go see, so we're going to do a giveaway. I'm going to do a giveaway. And so I've got a Sister Project that I can give away, and I've got books that I can give away. Give me 1 second, okay? And for those of you who are around early, you already know the answer to my question that I'm going to ask. All right. So I gave you a big clue. So hold on. I'll be right back. It's rained out. It's rained out. The race is rained out. So anyway, I can stick around then. All right. So it's time for a giveaway. It is time for a giveaway. Okay. Listen, I feel so strongly about this book that we're just gonna keep giving this book away because I really think that this helps so many people. One person on Facebook, one person on YouTube is gonna get this book. All right. So here is I don't make not gonna make it easy. I know Carol wasn't here at the beginning. I'm sorry, Carol. But it wasn't quite at the beginning, it was in the middle of the meeting. So I talked about 2 reflexes. One of them is where an organ affects the muscles, and the other one is where a muscle affects an organ. The first person to give me the name of that reflex, either one of those reflexes, we'll try this one first for a minute or two. This is a hard question. Let's see. If you want a copy of Breaking Through Chronic Pelvic Pain worth $35, I need you to give me the name of the reflex. All right. Teresa Kohler on YouTube, on Facebook has it. So Teresa Kohler, you are the winner on Facebook. Now YouTube, for anybody who, if you want the book, can you remember the name of a reflex in which an organ affects muscles or muscles affect an organ? Tanya, you were right there. All right, I'm gonna give YouTube. YouTube is always has a kind of a 30-second delay in the stream. So let's give YouTube a moment. Teresa, I need to write down your name. Hold on a sec. Where are my post-its? Here we go. All right. So Teresa Hartledge Kohler. Teresa. Okay, so Teresa, if you could email me your mailing address, icnetwork@mac.com, icnetwork@mac.com. You will get this. And Tanya Rosario on YouTube. You are the winner. So the answer was a viscerosomatic reflex or a somatovisceral reflex. Hey man, when you come to one of my support group meetings, I'm gonna make you work for it. We're gonna kick the butt of doctors who tell you this is not real. All right, so Tanya Rosario. So Tanya, if you could email me icnetwork@mac.com. I've got, here's your book. And Barbara, here's your book. And they will go out on Tuesday because I do believe tomorrow isn't tomorrow a postal holiday? And yes, this is my low acid decaf. 1/2 a shot with a lot of coconut milk. Teresa, you already have a copy, so you're giving one to your doctor. Good, thank you. Appreciate it. All right, guys. Hey, listen, I'm here. I'm here for the duration. If you got any other questions, feel free. If you're done, that's fine. I'll go take a walk. If you still have questions, give them to me. I'm happy to take them. Or I can read you a couple of case studies from the book, which would actually be a good thing to do. Let's do it. Let's do a couple of case studies. Hold on a sec. I think you will find this very, very encouraging. Yeah, baby. This'll work. Hold on. All right. Sarah's story. Sarah, okay, so these are some of the success studies of IC patients and bladder patients in this book, okay? Sarah's story. Sarah came to me at the age of 24 with a 1-year history of urgency frequency. She had been passing small volumes of urine 12 times a day on average. There was also delay when she tried to start her urinary flow, and once initiated, it was very weak. Sarah also mentioned that she had pain during deep penetration with intercourse, but that the pain subsided if she held still and waited for a short time. And for the past 3 months, she had been experiencing suprapubic pain, pain above the pubic bone in bed at night. These symptoms began within 24 hours after an intense orgasm during a period in which she was under a lot of emotional stress and was holding her urine back for long periods of time while commuting to school. In spite of negative urine cultures, Sarah had been treated with 2 courses of antibiotics. Not surprisingly, this failed to resolve her symptoms. A cystoscopy to evaluate the bladder and urethra was then performed and showed no abnormalities. However, the procedure itself gave her excruciating pain. Only acupuncture provided some relief. My examination revealed trigger points in the adductor muscles of the inner thigh, the rectus abdominis muscles above the pubis, the piriformis muscle hip rotators, and the quadratus lumborum muscles, which attach to the lower ribs and the top of the pelvis. The internal muscles of the pelvic floor, especially around the urethra and urinary sphincter, were markedly tender and duplicated her symptoms when compressed. This indicated the presence of trigger points there as well. Treatment consisted of internal myofascial release for pelvic floor trigger points and dry needling of the trigger points in the external muscles. The internal and external trigger points and secondary muscle tension quickly resolved. Within 1 month, intercourse and orgasms were pleasurable, and daytime frequency decreased from 12 to 15 times a day to 8 to 9 times. After 3 months, 15 office visits, voiding had stabilized for an average frequency of 7 to 8 times a day. Sarah's history includes a history of early traumas to the pelvis that could progressively increase the muscle tension to the affected area over time. At the age of 7, she slipped on a large wooden plank and landed on her vaginal area, resulting in bleeding. At the age of 16, she was kicked in the crotch and at another time was punched in the clitoris. The resulting pain was so severe she was unable to walk for a day. At the age of 19, she injured herself and lost consciousness after slipping on the side of a swimming pool. She was a gymnast at an early age and at 19 began dancing vigorously. This resulted in pain down her left leg and lower back, which she attributed to an injury of the sciatic nerve. As one incident after another occurred, trigger points formed. All or most of them appeared to have remained latent or asymptomatic. The only indication of a problem was pain down the back of her leg, which could have been the piriformis muscle compressing the sciatic nerve. One day, these tight, strained muscles were put to the ultimate test by a vigorous, prolonged series of contractions from an intense orgasm. Muscles around the urethra and the rest of the pelvic floor went into sustained, severe, self perpetuating spasm. The result was urinary frequency, diminished urine flow, discomfort above the pubic bone, and pain with intercourse. Sarah's story demonstrates how cumulative stresses and traumas to the pelvis can eventually explode into severe and sustained symptoms when a critical threshold is crossed. It also demonstrates urinary symptoms are more likely to reflect what's happening outside the bladder rather than inside the bladder. Therefore, practitioners are advised to evaluate and treat accordingly. Additionally, and importantly, it illustrates the power of myofascial therapy, which in this case consisted of internal myofascial release and dry needling of the trigger points. No other therapies were required, including bladder therapies. So remember, cumulative traumas. Cumulative traumas is really a theme here. Okay. Joan says, where can you get the wand? In our shop. You just go to icnetwork.org. Let's do another one. Kira's story. Kira came to me at the age of 34 complaining that for about a year she'd been urinating every 1.5 hours to 2 hours during the day and 2 times at night. Though considered symptomatic, this frequency is moderate relative to what many patients experience. What made it intolerable was the intense bladder and lower abdominal pain. She rated it on a scale of 8 out of 10 that accompanied urination and lasted for approximately an hour. Prior to the onset of these symptoms, she had occasionally gone up to 12 hours without voiding and had experienced no urinary problems. Kira's history included many musculoskeletal issues dating back to high school when she was involved in an auto accident. Low back pain began at the age of 21, requiring periodic adjustments. Her neck also went out just before her urinary symptoms began. Upon examining her, I found 3 clinical signs for pudendal nerve irritation or injury. There was sensitivity to skin rolling and pinprick tests around the perineum and sit bones, and exquisite bilateral nerve sensitivity when palpated internally. So, in other words, when he pushed those tissues with his finger vaginally. In addition, the muscles of the pelvic floor and perineum were tight and loaded with trigger points. There were also internal trigger points in the hip rotators, both the piriformis and obturators, which, as I explained, can directly compress the pudendal nerve. Internal myofascial release performed at the time of my exam relaxed the muscles around the nerves. This almost completely cleared the skin and nerve sensitivity. Just that one treatment gave Kira dramatic relief in terms of frequency and bladder pain. After 3 treatments, the nerve sensitivity to touch had diminished 50%. She was able to sleep 7 hours without voiding, and urinary urgency and pain were gone. Then, to reduce the tension around the pudendal nerves, I perform bilateral trigger point injections in the piriformis muscle attachments. After 2 months of treatments, dysfunctional pelvic floor, perineal, and external hip rotator muscles normalized and the pudendal nerve calmed down completely. Since then, Kira has continued to do well. So, this young woman was lucky to have received appropriate treatment for her pudendal neuralgia within a year of the onset of her symptoms. Most patients suffer far longer than that because before the cause of their problem is finally identified and addressed. As I emphasized in chapters 5 and 10, if a nerve injury is allowed to persist for an extended period, it can take a long time to fully resolve. So in Kira's case, the internal segments of the piriformis and obturator muscles had indeed compressed and sensitized the pudendal nerve. This local dysfunction in combination with abnormalities reflected in her back and neck pain caused the pelvic floor muscles and perineal muscles to tighten, the external urethral sphincter to tighten. She developed an abundance of trigger points that created her urinary symptoms. All right. And as for quote unquote bladder pain, her bladder was not involved in her pain at all. It was all her muscles. Let's do one more. You know what? I got to sit down again. Hold on. Stand, sit. That's the story of my life right now. Stand, sit. So hold on a sec. Oh, I just have such. This is what I get for not doing my stretches before I started the stream. All right. Let's do one more. Xandra's story. Very recently, 33-year-old Xandra consulted me for treatment of IC. 10 years prior to her appointment with me, she had developed urinary frequency urgency and urethral pain with voiding. At that time, she also had bladder pain with or without bladder fullness, and periodically she would get the urge to void, but had difficulty doing so and felt like she couldn't completely empty her bladder. Given these symptoms, I was not surprised to hear that she recalled having voiding difficulty as a child. Antibiotics were prescribed, even though infections were not found. Eventually, she saw a urologist who performed a cystoscopy and the installation of potassium chloride in the bladder. Both of these tests were quote unquote consistent with IC. The prescribed treatment was urethral dilation, which was extremely painful and caused severe flares. She had other therapies, including Elmeron, Vesicare, amitriptyline, hydroxyzine, DMSO, and finally heparin installations for every 6 months for 7 years. The installation or delivery of medication into the bladder requires insertion of a catheter into the urethra. This can be very comfortable when sensitive and muscle spasms are present. The last of these of treatment, which had given Xander very varying periods of relief, was performed approximately 1 year prior to my initial evaluation. She told me that catheterizations, here, I got to sit correct here. She told me that the catheterizations had been almost unbearably painful, that they had given her occasional bladder infections, and that her bladder had become so irritated she was having difficulty holding the solutions as required. In short, the quote cure had become as debilitating as a problem as it was intended to eliminate. However, over the years, there had been some improvement. When Xanda first developed her symptoms, she was avoiding small volumes every 15 minutes. But with the above treatments, her frequency had dropped to every 45 to 60 minutes and twice a night. She rated her pain as being fairly consistent, 4 to 5 on a scale of 10, but that occasionally would reach 8 or 9. On further questioning, Xandra mentioned having pain in the sit bone area with sitting for as long as she could remember that referred to the tailbone in the back of her thighs. She never told anyone about this because she thought it had to do with the way she sat and was unrelated to her urinary complaints. She also reported a past history of bilateral Achilles tendonitis and indicated that she was presently dealing with low back and neck pain. My external examination revealed extreme sensitivity over sit bones and perineum to the skin rolling and pinprick test for pudendal neuralgia. I also noted bilateral Morton's toes, many trigger points in the hip rotator muscles at their attachments, trigger points in the quadratus lumborum muscles that help stabilize the pelvic floor, and trigger points in the lower rectus abdominis muscles. Internally, Xandra had exquisitely tender pudendal nerves with trigger points in both the muscles. All right. Which seemed to fit the picture of a pudendal nerve entrapment as a core problem, not interstitial cystitis. After I performed myofascial release to relax the pelvic floor muscles and mobilize the pudendal nerves, she experienced temporary relief. However, because the pudendal nerves were still tender, I did nerve blocks. Here it is important to note she had more pain in the left buttock with sitting, and the left nerve was more painful of the two. It is also important to emphasize that pudendal nerve blocks with anesthetic and cortisone are okay, yada, yada. In Xandra's case, the pain was sitting and all the urinary symptoms, including her bladder and urethral pain, disappeared for 9 hours after a nerve block. At that point, urinary frequency returned, but there was no bladder or urethral pain until the following day. 2 weeks later, the urinary symptoms reappeared, but their intensity had diminished. All of the above evidence clearly points to pudendal nerve damage as a source of Xandra's IC symptoms. Anyway, there you go. I mean, he's got story after story after story, and ultimately, in the end, this is he calls it rounding up the perpetrators. There are just layers of issues going on. Layers of issues going on. There's muscle issue, muscle tendon, nerves that are involved, bladder wall that gets compromised. And then we've got to deal with all the other ways that our life changed when we're struggling with something like that, which is going to be some anxiety and emotional components and all that sort of stuff. And so you can't expect one treatment to to turn all of this off. There are multiple things involved and multiple things that need to be addressed. So again, like in my case, my dominant problem is in my left, around my left sit bone, and the muscles supporting my SI joint, particularly my piriformis muscle and my obturator muscle. And that ultimately is a foundation for all of my IC symptoms. Nana says, so is a Dr. Weiss opinion that the majority or even all subtypes involve PFD? Yes. 90% of the patients referred to him, if not 95%, have muscle issues. And the muscle issues can be related to bony structures, foot problems, leg problems. But ultimately, in the end, yes, he is of the belief, and I completely support him, that the muscle component and the nerve component is the dominant driver in IC symptoms for the majority of patients. Now, again, some patients have viral infections in their bladder, Hunner's lesions. Some of you might have candida infections, fungal infections. Some of you have chemocystitis from a chemical injury. I'm not making broad strokes, but even if you do have, listen, if you get stabbed in the bladder or you have a bullet wound to the bladder's injured, you can damn well bet the muscles are going to get tight. Now and as we wait for the bladder to heal from that injury, your muscles are tight. And the challenge is that the muscle memory gets messed up. And so for some people, it begins with some sort of event that provokes bladder pain and the muscles get tight. But for many, then we would call that a viscerosomatic reflex. But for many patients, it's beginning with a muscle trauma, a muscle event where the muscles are indeed eventually starting to involve the bladder and the viscera. And so don't underestimate the importance of this muscle work. And listen, if you go to a pelvic floor physical therapist and it hurts the first time, hallelujah, baby. That's success. You know why? Because it means they touched it, they found it, they had their hands on it. That is great news. If you go to pelvic floor physical therapy and they can trigger a flare, that is the best news ever because it means they found it. Now, what you do is you go back and say, okay, you found it. Now let's work on it because that was pretty painful. And even now, when I do my internal massage, I did it 3 days ago and let me tell you, it wasn't hurting so much when I was doing it. I mean, where it was hurting, I was working in that area, right? And I eventually got the muscles to release so that they stopped hurting. But afterwards, you're kind of walking like you're pregnant, with your knees kind of open and you're going, oh, okay, what the hell was that? And then again, I did it yesterday afternoon. And afterwards, yeah, that area was uncomfortable for about 20, 30 minutes, and that's when you throw on your heating pad and you go sit in a recliner and just try to ride the wave. Kathy says, where do you find a doctor to treat these symptoms? Sounds a lot like my issues. Well, a physical medicine specialist is somebody who would work with bones and muscles. A physical therapist would work with muscles. A urologist or a gynecologist or a urologist, they're very organ centric. They're going to work with organs. They're not necessarily going to work with muscles. You would go to a podiatrist if we can point to your feet and the way you're walking as contributing to this long-term chronic muscle tension. He talks a lot about, when you're young. So if you're born with one leg longer than the other, or let's just say you were a kid and you broke your leg and one healed shorter than the other, your tissues are very resilient when you're young. You might not feel the fact that you're walking with one leg shorter than the other. And he said it's not until your 30s or your 40s that you start getting kind of the wear and tear issues, where you start feeling and noticing those symptoms more. This kind of just a kind of a cumulative damage over time. Kathy says, you live in Monterey. Oh, hey, how's life in Monterey? Gosh, I love getting down there. I haven't been down to Monterey or Carmel in 20 years, one of my favorite parts of the country. In fact, Kathy, I'll tell you right now, if we have fires again this year, right? Because, I live in Northern California, the heart and center of the firestorms here in the United States. Oh, it's just a beast. It's so hard to go through. One of my friends evacuated to Monterey uh, last year, and that's real tempting. I don't know if I could get my parents that far, but I'd love to get down to Monterey. But you guys have big fires down there too, down by Big Sur. Joan says, so it seems like I ended up in the right spot with physical therapy and PT. I say that's a success. Now back to PT. Wasn't your favorite? Yeah, it wasn't my favorite either, but I mean, I could definitely see hallmarks. It's just, Joan, I failed at home. That was the problem is I failed at home. I wasn't doing my homework. And it was just out of a lack of knowledge combined with being super sensitive down there and dealing, you just got to bite your lip and get in there and learn how those muscles feel. Kay says, my urologist told me when diagnosing me, he said it can only be three things: bladder, pelvic floor, or bowels. Yeah, and he's right. Well, except he missed nerves. Because ultimately, in the end, it's the nerves which connect them all, right? It's the nerves that connect them all. All right, my friends, I think it's time to cut this short. I got to get out of this chair. I'm really trying to be attentive after reading this book to any pain or discomfort I feel when I'm sitting. And so I'm going to say it was my honor and privilege to be here with you today. And I'm going to give you your homework now because you have homework. You may not be passive aggressive here. I don't expect big things from you. Now, my job is to motivate you, and my job also is to kick you in the butt and get you to start doing some things, right? Right. So for 15 minutes a day, I need you to do something for your bladder or your pelvic floor. No, 15 minutes a day, do something for your bladder. Another 15 minutes a day, do something for your pelvic floor, which is what I'm going to go do because I'm going to go into my living room with my foam roller and I'm going to stretch out my damn muscles, which are super tight right now. For 15 minutes a day, I need you to do something for your spirit and your soul. Give your body a little bit of a rest. IC doesn't change your heart. It doesn't change your soul. It's below the waist. Keep it there. But you need some nourishment. You need some comfort. So whether it's going and sitting in the sun, going to church, taking a walk, do something that nurtures you. And I need you for 15 minutes a day. Do something for your noggin here. Listen, The book is free on Kindle. If you get Kindle, if you have that monthly Kindle subscription. If you don't have it, it's $9 on Kindle. And it's an absolutely life-changing book. If you want the paper copy, you can buy that on Amazon for $35. We're going to have it, I hope, for $29 this week in our store, somewhere in there. I want it $5 cheaper. I personally prefer the paper version, just because I have lots of highlighting. You can see, man, I study my butt off stuff like this because I it's my job and I want to make sure that I can educate you correctly with this information. All right. Last but not least, listen, getting back to this tremendous connection we have in our human body, that when you are under stress, you tighten your pelvic floor muscles. We are all no part of our body exists in isolation. Everything is remarkably interdependent and dependent on each other. And that's something that he talks about beautifully, that the ultimate flaw in the treatment of chronic pelvic pain in IC today is that people are focusing on organs rather than the relationships between all the structures. And one of the things that we know about pain and the way pain is processed is that um, pain from your bladder, pain from your pelvis goes up to your spinal cord. The nerves deliver that pain message to your spinal cord. And then that pain message is sent up to your spinal cord to your lower brain. Your lower brain performs one critical job. It's a gating reflex. You've got thousands and thousands of pain nerves in your body. If they were all firing at the same time and overloading your brain, you wouldn't know what to do next. So, what happens at the lower brain is it gates the most important pain messages. So it only lets the most important pain message through. So if you stepped on a nail, believe me, that pain message is going to go through. But let's say a week later you fall and you break your foot. You're not going to feel the ankle, and you're not going to feel the nail anymore. You're going to feel the broken bone. Only the most important pain messages get through. So, one of the things that you can do when you're in pain is create a distraction. So, for example, slap your inner thighs. If you're in pain, you can slap your inner thighs, and that creates a diversion. Or you can grab the webbing between your fingers and squeeze there. That creates another diversion too. So, principle number one with pain management is to create a diversion. I once flew to London in a severe flare, an eight or 10 hour flight, and I had a TENS unit on my inner thigh, and I just turned it up, and that created a distraction. Okay, so concept number one at the lower brain is to create a distraction. But the next thing is the midbrain. At the midbrain, your brain establishes context to the pain. So if that pain is accompanied by tears and stress, your brain goes, uh-oh, this could be life-threatening, and it intensifies it. But if pain is accompanied by laughter, like you're riding a roller coaster and you get thrown to the side of the car and you hit your ribs, but you're laughing hysterically, your brain goes, well, she's laughing, so this must not be really bad. So what happens is your midbrain minimizes the pain. So your last piece of homework for me, uh, and I can explain the upper brain too, but your last piece of homework for me is I need you every single day to watch something funny. End your day with humor. I watch a funny movie. For those of us who are older, a Jerry Lewis movie, whatever. I Love Lucy, Abbott and Costello. You can watch all the new stuff, the Kevin Hart movies, all that sort of stuff. Watch something funny, because when you're laughing, your brain goes, this this isn't as bad as it could be, and it will minimize it. Now let's talk about what happens. So at the midbrain, if you're crying and you're stressed, that's going to go to your upper brain, and it is your upper brain that directs your body what to do next. So if you put your hand on something hot, it's your upper brain that immediately tells you to pull, to pull your hand away. Now, what's interesting about the upper brain is that if you were to look at a brain scan of somebody in pain, like you tend to think that that pain message just goes to one part of the brain. Like it's just got to go here. Like it's just right here, right? But the it's fascinating because really what happens is your brain lights up like a thunderstorm. And so you get active here and then active here. It's like thunderstorm, 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 thunderstorm. And the more intense pain, the more parts of the brain get involved. And so, another pain relief strategy that they have you do that can be really helpful is to start using your brain to isolate areas that will allow it to expand. You know where I'm getting this is from, where is it? This book, When It Hurts Down There, by Dr. Angie Storr, who is a pain specialist in Texas, and she's fabulous. And this is a great book to have, and it explains the nerves and how and the things to do, and it gives really good tips. And this is a really great picture, by the way, because it shows all the nerves in the pelvis merging at the spinal cord, which explains how they all often become involved. But at the upper brain, what they would have you do is things like, here, hold on. Number one, use foul language if the pain is really intense. You can curse. She says if you ever hit your thumb with a hammer or stubbed your toe on a table, you've probably sworn or at least wanted to. This kind of reactive vocalization starts in the lower brain gateway. It's a spontaneous reaction to pain, and it actually reduces the pain signal. Now, I'm not suggesting you pick up a general swearing habit. This only works well when you're not accustomed to using foul language regularly. And if it's against your morals to use foul language, then you can skip this technique altogether. Yes, I have been known to swear. So, doing things like puzzles, doing things like writing a compassionate letter, meditation apps, positive memory associations. If you have a positive memory that's related to a smell, it works particularly well. If your grandma's house always smelled like applesauce cooking, find yourself a recipe for applesauce and make it at home. If the smell of pies remind you of mom, then go to a bakery once a week just for the aromas. Deep breathing. Anyway, all sorts of really good things in here that will help you kind of de de-emphasize and deactivate some of that pain processing that you're kind of stuck in. So this would be another book I would recommend, When It Hurts Down There by Dr. Angie Storr. We don't I think we have it in our shop. I think we do. Yeah. All right, my friends. I don't know about you, but I gotta go. I gotta go stretch. My muscles are way too tight. Okay. I will see you later. I will be doing another meeting, either in the middle of the week or next Sunday. Make sure you like our Facebook page, subscribe to our YouTube channel, because when I go live, you will get notified. And I wish you all a wonderful night's sleep tonight and a good holiday tomorrow. And I wish you be well. Be well. Yes, I'm going to go walk. Kathy says, come on down to Monterey. I'd love to have you. Thank you. All right, guys. See you later, alligator. In a while, crocodile. See you soon, baboon.